Should I just start or like? Um, we like. Hello. So like, should I start solving the GT? Acha, I was expecting an intro. Okay, okay, okay. So hi guys, welcome back. So this session was expected to happen on the 15th, but due to some technical glitch, so there was some lagging of audio and video. So we will just continue the same GT. So we are resuming the same GT, and we were in section B. So starting from the first question, which of the following is not a cause of secondary hyperparathyroidism? So after reading the question, you should just have like some idea of the question in your mind before seeing the options, so you do not get confused by the options itself. So not a cause of secondary hyperparathyroidism, we already know parathyroid adenoma is a cause of primary hyperparathyroidism, so we can just select this option without looking at other options, but you can just see to confirm your like answer. Lithium, vitamin D deficiency, CKD, these are all causes of secondary hyperparathyroidism. They have asked not a cause of secondary hyperparathyroidism, so this is the correct answer. So in this like long history given question, you should just start reading by the last line of the question, so you get the idea what the question is all about. So they are asking about the diagnosis in the question, so you just start reading the question. 45-year-old man with a history of chronic alcohol abuse presents to emergency with the altered mental status, disoriented, confused, difficulty walking. So it's going towards like psyche, alcohol abuse disorder. His family reports he has been consuming excess amount of alcohol for several years and has a poor appetite recently. He has bilateral. They have given clinical feature of nystagmus and gait ataxia. Laboratory investigation reveal elevated MCV that is expected in a chronic alcoholic and decreased serum thiamine level. What is the most likely diagnosis? So, like chronic alcohol abuser, they have given also decreased serum thiamine level, and they are given clinical feature of nystagmus and ataxia. So, it's going in the direction of Wernicke's encephalopathy. So, that's the option. Korsakoff, there are confabulations. This cannot be liver disease or cerebral stroke. So, they are given their classic triad of clinical features of Wernicke's. Which of the following structure form the medial boundary of femoral triangle? So this is the basic like cramming anatomy question. So you just remember the boundaries of all the triangles in the anatomy. So medial boundary of the femoral triangle is formed by the medial border of adductor longus. So this is just a memory-based question. Increased alanine during prolonged starvation represents. So let's read the options. Increase breakdown of muscle protein. It might be true like prolonged starvation, there is a breakdown of muscle, so like alanine amino acid will increase. Impaired renal function has nothing to do with prolonged starvation. Decreased utilization of amino acid from gluconeogenesis. I think in starvation there is more of gluconeogenesis, so this option does not look correct. Leakage of amino acid from cells due to plasma membrane damage. So I do not think this is the correct option. This is looking wrong. So I'm just guessing my answer on this increased breakdown of muscle protein, because like chronic starvation, protein will break, and alanine, which is a amino acid, will increase in the blood. So I'm going with option only. So what is the definitive treatment for the condition? Mother of a 1.5-year-old child comes with complaints of child is vomiting frequently. Since the 2 weeks are not gaining weight, vomiting is non-villous. On abdominal examination, there is a palpable oval mass. So palpable oval mass, you already know, this is pathognomonic sign of CHPS, congenital hypertrophic pyloric stenosis, and they have asked the definitive treatment of this condition. So we have read CHPS is only treated by surgery. So there is a pyloromyopathy in the option, atropine alkalosis, and like they have asked the definitive treatment. You should read this line very carefully, because if they ask the next line in the treatment, then the answer will be obviously different. They will be like correction of like some acid base disorder first, then the surgery. So definitive treatment is obviously the pyloromyopathy. What is the Glasgow outcome score for severe disability? So, Glasgow outcome score, like, I do not remember exactly what the score is, but like I read this score in CNS surgery after like CNS trauma, there is some brain hemorrhage, etc. So, what is the like outcome of that incident? So, I remember it is marked from 1 to 5, and one is death. Two is like when the person become comatose. Three is severe disability. Four is some mild disability. And five is complete recovery. So I will just go with three, and I'm not sure about this score. So I will just mark for review. The culture media for fungus, SDAGR. So this is given the option. All these three are for the you read in bacteriology. This is the only agar you read in mycology. So this is like correct. Which of the following feature is not seen in this patient? So you have to make a diagnosis, then you should know about the condition. So this is kind of a two-step question. So 23-year-old male with a history of drug addiction presents to symptoms suggestive of cocaine overdose. They have given the diagnosis. So in cocaine overdose, we see there are symptoms of like sympathetic overactivation. So bradycardia will not be seen. They will be like hypertension, tachycardia. So we can mark this option. Let's see the other option first. Agitation, myocardial infarction, you see in cocaine overdose. Hyperthermia, obviously, when there will be sympathetic overactivation. So hypothermia can be seen. So bradycardia, this option, this is definitely not seen in cocaine overdose. So we will mark that. What is the most likely causative organism? So looking like a microbiology question. So HIV infected 55-year-old male with a CD4 count of 45. So when they give like CD4 count, you should remember on what level which conditions are seen. So like below 50, there are two conditions mainly seen, MAC and CMV. So he also complained of weight loss, night sweats, fever. On examination, hepatosplenomegaly is noted. On examination of his BAL fluid, macrophages filled with acid-fast organism. So, like, there is important differentiator is CD4 count. So, CD4 count is below 50, and symptoms that like of TB. So, below 50 CD4 count and TB symptom, and they have also given acid-fast organism. So, I will go with MAC. So, let's see the option. Mycobacterium tuberculosis symptoms are like, but count is like 45. So, you see TB around like less than 200. So Mycobacterium avium complex is the like infection that occur below 50. So I will go with that. Identify the type of reaction given in the image. So looking like biochem question, they are given amino acid converting into a keto acid 2 and keto acid converting into amino acid, and the cofactor given PLP, vitamin B6. So this is like basic of like amino acid metabolism, transamination reaction, the first chapter read in protein metabolism. So like transamination I can see. So these are the option I was talking about. Like if you go directly to the option without thinking about the question, so like you see like transamination, deamination, trans deamination. So like there are some kind of confusing options. So in like heat of movement, when you are giving the exam, so you might get confused. So just before going to the options, like prepare some answer in your mind. Okay, what should be the answer of this question? So transformation is the right. Under MCS program, what is the composition of iron and folic acid tablets to be given daily to a mother? So we know it is 60 plus 500. So 60 mg iron and 500 microgram folic acid. So we'll see the option. So like in these type of question where figures are given, you must be like extra careful while solving them, because like they will change iron and folic acid. They will change some units mg and microgram. So 60 mg iron and 500 microgram folic acid. This is looking correct, but we will just check like in like speed other options. 100 mg iron is wrong. 100 microgram folic acid is wrong. 100 mg iron is wrong. So we have marked a correct answer. Which among the following is false according to the findings? Okay, so a man was rushed to the hospital after a bullet injury. Investigation, there was injury to the left side of hemisectional spinal cord at L4 level. So, like this is the Brown Sequard syndrome. So, they have asked the false option according among the four. So, they have given on the hemisection of the spinal cord at the left side. So, you know where there is a hemisection spinal cord on the left side, motor loss is on the left side, posterior column will be on the left side. Spinothalamic, they cross in the spinal cord. So those findings will be seen on the right side. So loss of proprioception left side, 2 point discrimination. This is correct. These are posterior column, same side. Left side loss of pain and temperature. This is not looking right. Right side loss of pain and temperature. Right side spinothalamic tract will be affected. And left side motor loss, paralysis and spasticity below the level of lesion. So left side motor symptoms. So this is wrong. Baki, other three options are correct. Which of the following is falsely matched? So you have to choose the incorrect option. Antemortem wound, positive vital reaction. Okay, like in antemortem wound, you know vital reaction will be seen, and postmortem no vital reaction will be there. Antemortem wound, negative vital reaction. So like in antemortem wound, there must be a vital reaction. It might be positive, it might be negative, but there must be a vital reaction. So like this option is to confuse like some students, they don't know this fact. Like negative vital reaction can also be seen in antemortem wound. Postmortem wound, there will be negative vital reaction. No. In postmortem wound, there will be no vital reaction. So this is correct, this is wrong. In postmortem, there is no vital reaction, no positive reaction, no negative reaction. So this is like a smart question to confuse the students. All of the following are cause of high anion gap metabolic acidosis except. So you have to choose normal anion gap metabolic acidosis option. So this is the same question which came in this November INI. It was the like same question. Options was some different. So diabetic ketoacidosis, there will be high anion gap metabolic acidosis. In RTA, renal tubular acidosis, it is like you read in normal anion gap metabolic acidosis. So this is like a starvation, you will see lactic acidosis and there will be high anion gap. Renal failure, you will see high anion gap. So renal tubular acidosis, there will be no high anion gap metabolic acidosis, except you have to carefully read this except. This patient injured nerve originates at what spinal level? Okay, so 45-year-old woman who recently underwent a left mastectomy and axillary dissection for the breast cancer now presents to her physician with chief complaints. She feels her shoulder blade, scapula, sticks out sometimes. So they have given like winging of the scapula. She denies any pain. There is a history of mastectomy plus winging of scapula. So this is a like first year anatomy question. So there is a long thoracic nerve injury while doing the mastectomy, while doing the axillary dissection. So brachial plexus, you must remember, it is like important stuff for PG entrance examination. So long thoracic nerve is C5, C6, C7. So you must remember that diagram. So you can remember in the examination hall. So which of the following is true regarding changes in puberty? So they have given like sequence question. So menarche, growth spurt, thelarche, pubarche. Growth spurt, thelarche, menarche, pubarche. So I do not remember like the correct sequence, but like I have an acronym for this. I remembered like the TPM, teacher parents meeting, like in puberty. So there will be first T, then P, then M. So M cannot be in the first place. T, M, P. No, this is wrong. M, T, this is wrong. Like thelarche growth spurt, then thelarche, pubarche, menarche, then TPM. So I do not know about this growth spurt, but other options are definitely wrong because I have read TMP is the order. So this is the correct option. Most common congenital heart wall defect is. So congenital heart defect, that is most common. So I do not remember which is the most common. Let's see the options like mitral stenosis, mitral regurgitation, bicuspid aortic valve. This is most common in Turner syndrome. So I don't think it will be the most common congenital. tricuspid mitral regurgitation, mitral stenosis. So I think it might be mitral stenosis. Um, I will just mark it and mark for review. We will come back to it. So what is the most likely diagnosis? They have given some histopathology image. So I'm not very great at reading histopathology emails, so I mostly rely on history, like options and some pointer from the photo. 50-year-old building contractor complains of dyspnea and mild cough. Initially, he had dyspnea on exertion, which progressed to dyspnea even at rest. So, like it is a pulmonology question. So there is a dyspnea building contractor chest X ratio calcium at pleural plex. So this is like signature, like this is pathognomonic for asbestosis. There is a history obviously matching it with it, building contractor and fibrosis. So lung fibrosis, pleural plaque, and a building contractor going in the direction of asbestosis. Image of lung biopsy. So let's see, they have marked this is like ferruginous body that we see in asbestosis. So without histopathology image, you can do the question. So this is like a very famous image. You must know this image, but like even you forget, even you can do this question just by the history. They are like given 3 or 4 pointers in this question. So this is only the asbestosis, nothing else. So what is this condition called? So I'm not very great at reading images, so I just rely on history first. 26-year-old female, married for 2 years, visits an infertility clinic. So scan infertility topic. He was put on HMG on treatment, CET dyspnea and abdominal pain. So this is looking like OHSS, ovarian hyperstimulation, because he was on HMG and like she is suffering from infertility. USG reports show the following image. So there are so many cysts seen in the like I guess this is the ovary. So this will be OHSS, so ovarian hyperstimulation syndrome. So like after seeing the picture, like many students can tell the difference between PCOD and OHSS, not me. Like this is very confusing for me, USG image. But I just like if you see like infertility clinic and she was put on HMG, there is a history of dyspnea and abdominal pain. These all are pointing towards the OHSS only. So this cannot be other cysts like theca lutein, follicular cyst. There will be like clinical history will be like bilkul different from OHSS. So for the general examination finding of 40-year female admitted in medicine ward, what is likely nutrition deficiency patient is having? So like they have given like pinpoint hemorrhages on his leg, and there are some like hairs are also some. So pinpoint hemorrhage points to a vitamin C deficiency scurvy. So I will mark vitamin C. Thiamine में we don't see hemorrhage, riboflavin, niacin. We do not see the pinpoint hemorrhages. So scurvy. Which of the following histopathology findings are not seen in this condition? So, like this, these are new type of questions which need asked now. So, like instead of giving the image, now they explain what is seen in the picture. Or they expect you to know. So, what are the like finding on histology? What are they write on histopathology report instead of the image? So, 15-year-old boy complain of dyspnea. Wheezing is observed. So, 15-year-old boy plus wheezing just point towards asthma. On examination of sputum, charcot-laden crystal and Krishnan spirals. Which of the following histopathology findings are not seen in this condition? So, a diagnosis is complete. This is asthma. They have given Krishnan spirals, charcot-laden crystals. So, we know 3 CF of asthma, crystals, Krishnan spirals, and Crayola bodies. So, which will be not seen in the condition. Thinning of airway wall, I do not think so. In asthma, there is like in chronic asthma, there is thickening of airway wall. There is like hypertrophy of the muscle of the airways. So let's read other options also. Subbasemental fibrosis, obviously in chronic fibrosis, you see this. Increased size of submucosal gland, obviously there will be increase like mucus production. Increased vascularity. I'm not sure about this, but obviously this is like an inflammation, chronic ongoing inflammation. So there will be increased vascularity. So like thickening of the wall is definitely I know. So thinning cannot happen and they was not seen in this condition. So I will mark this option. Ovulation trigger can be given when. So this is from like infertility. Follicles reaches up to 18 mm. Now this is looking right. Like I do not remember the correct size, follicle size when we give like trigger. So let's see the other option. Serum estrogen level is 200 picogram per ml per dominant follicle. So 200, this figure I remember. And if one of the above, both of the above. So I'm not sure. I remember this thing like serum estrogen 200 picogram per ml per follicle. We give HMG trigger. I do not know about like 18 mm size is correct or not. And they have given like any one of the above and both of the above also. Uh, so I will just mark for review this question. What is the likely explanation the medicine consultant has given for ECG? So this, whenever there is ECG question, just read the history first because that might help you. You might not pick the ECG changes so easily, like after just an undergraduate level. Following is ECG of a patient done as part of routine workup before a major surgery. Seeing the abnormality, a medicine consultant consultation is done to comment on the ECG. What is the likely explanation medicine consultant has for the ECG finding? So they have not given much of like clinical history. So we have to see the like ECG. They have given ischemic heart condition, cardiomyopathy, hypertensive disorder. So let's see the ECG. So they have given V1 to V6. So like V1 is more negative. V1 to V6, we know ECG progresses like V1 is this negative wave is prominent, and when we go towards V6, there is like positive wave that becomes prominent. Ischemic heart disease, they would have given ST segment elevation, and like there is no emergency. He's not complaining of chest pain. It is just a like routine workup before a major surgery. So ischemic heart condition is less likely, but I'm like Q wave or anything. I am not sure. Let's see cardiomyopathy. ECG for cardiomyopathy is less likely. Like examiners of NEET and INI CET, they do not give like ECG for cardiomyopathy. So this is like I think this is incorrect. And hypertensive heart disease. So it's looking like right because like major surgery before this is a routine workup. So cardiomyopathy cannot be. Ischemic heart disease like the question will be around like emergency. The patient come to emergency with like chest pain. ECG I do not like. I cannot comment on the ECG, but there is like more negative towards like V4, V5, and V6. So I'm not sure. I will just mark hypertensive heart disease and mark for review. What is the most likely diagnosis? One step question. 70-year-old smoker complaining of multifocal bony pains for 6 months. On examination, firm non-tended right cervical lymph node, virtual lymph node. So definitely going in the direction of cancer. Serum calcium level is raised. His chest X-ray shows 6 centimeter mass in the right lung. So they have given the tumor in the lung, invading the mediastinum. Image of a biopsy from a lung show keratinization and necrosis. So they have given so many points. Like they have given like cervical lymphadenopathy. Serum calcium level raised. It is pointing towards squamous cell carcinoma of the lung. Also, he is a heavy smoker. They have given smoker. So 2 points towards the direction of squamous cell carcinoma. They are given like chest X-ray mass and image from the biopsy of keratinization. So like after keratinization is given, there is no doubt this will be squamous cell carcinoma. So like squamous cell carcinoma, we also read three C's. This is a central mass. Calcium will be high. Identify the instrument used to insufflate the peritoneal cavity. So this is Varis needle, like while like creating the pneumoperitoneum. So this is various needle. They have given like other options. I do not know about any of the option. Lens, Matthew, Jack. I have read varies, and they also given like insufflate the peritoneal cavity. So this is the right. Yeah. Pitriasis versicolor is caused by Pitriasis versicolor. So Pitriasis versicolor was caused by like epidermophyton microsporum trichophyton. These are like dermatophytosis. So pityriasis is not caused by like dermatophytosis. Malassezia furfur, like pityriasis versicolor, I do not remember completely, but I think it was like meatball appearance that like Malassezia global or Malassezia furfur. So we can also do the question by ruling out. So like microsporum, trichophyton, epidermophyton are dermatophytes. They do not cause pityriasis versicolor. So Malassezia furfur will be the right answer. Root value of the nerve supplying the skin adjacent to the cleft between first and second toes. So anatomy question. So they have asked about the root value between first and second toe. I am not sure about this, but dorsal primary rami cannot be the answer. This I can tell. I can rule out these C and D two options. So ventral primary rami of L4, L5, S1, S2, and S5, S1, S2, S3. Uh, so I'm not sure about this. So because between like first and second toe, there is the one nerve like deep peroneal nerve supply the area, and I do not remember the root value of this. So we will come back to this question. For now, I am skipping it. Which is the best diagnostic evaluation? So you have to make the diagnosis, then you have to like what investigation will do. Two-step question. So 3-day-old baby is brought by the mother with complaints that child has not passed stool since birth. Abdomen is distended. Stop taking feeds since morning. NG tube can be passed per annum. That show stool staining. So like NG tube can be passed per annum. So like this is the thing we did in our PEDS intensive posting. So there is by this line they want to tell you there is no atresia. There is no anal atresia. The like opening is open. You suspect the head spring disease. They have given the diagnosis in the last line. So I just tell you you should read one or two line. So this is like bakwas they have given to just waste your time. You suspect disease in the child. What is the best diagnostic evaluation? So this is like simple one liner. They want to ask you that how to make the diagnosis of Hirschsprung disease. So best they have asked. So we will go with rectal biopsy. So you have to read this point very carefully. What they are asking. If they are asking next or best, so biopsy is the best for Hirschsprung disease. What is the gold standard investigation in case of nodular goiter? So, in any of the thyroid swelling, gold standard we do FNAC. Like CT scan, there is no, like very minimum role in thyroid. MRI, there is like you don't know study in thyroid. USG we do as radio investigation, but they have asked like gold standard. So obviously, no one can beat the histopathology or like FNAC. Which of the following monoclonal antibodies is approved for hereditary angioneurotic edema? So monoclonal antibodies. So let's rule out the options first. LM2 this is like anti-CD52. So I do not think it is giving angiotic edema. This is something to do with like histamine or C1 inhibitors. Lanadelumab, I do not remember this. Basilotocumab. So like they have given like map for monoclonal antibody. Toxo is for toxins. So this will be like for bacterial toxin. And I do not remember correctly, but it is I think it is for like uh, Clostridium or anthrax toxin. So like ये तो option rule out हो गया है. Canakinumab. So mab, this is looking like immunological drug. We have ruled out A. We have ruled out C. Lanadelumab and canakinumab. So canakinumab, I think it is against like IL-17 or IL-23. Okay, like I remember reading it in like rheumatoid arthritis or like psoriasis chapter. So I'm thinking like lanadelumab might be the correct answer. So let's see again. So I and C I have ruled out. Canakinumab, this is like yes, it is against IL-17, I think. So this is like I remember reading in psoriasis. So this cannot be like angioneuritic edema. So lanadelumab, I think this is the correct answer. I have marked it, but I will review it later. 40-year-old women is diagnosed with chronic gastritis. Which of the following complication may occur? So in chronic gastritic complication, there which can happen: mucosal atrophy and intestinal metaplasia, dysplasia gastritis cystica. So in chronic gastritis, obviously metaplasia can be seen, mucosal atrophy and metaplasia. Dysplasia obviously like can be seen, like we see like cancer in chronic gastritis. So these both options are looking correct to me. Gastritis cystica, I'm not sure. So I will just mark all of the above and I will review it later. Average weight gain during the pregnancy in poor Indian women. So, I remember in first trimester there is no weight gain. So remaining 6 months there should be 2 kg per month. So that give our 12 kg. But like they are given average weight gain during pregnancy in poor Indian women. So like 12 kg is ideal weight gain that should happen in pregnancy. But like in poor Indian women, they are asking about average. So this is very less. I think like it was less than 10. 10 to 12 they say should happen ideally, so these cannot happen in poor Indian women. So 6.5, I remember reading it like around 6, so I will just mark for review. Out of this, which was the rate limiting step in hepatic bilirubin metabolism? But after hemoglobin catabolism, it is catabolized three-step metabolic process: uptake, conjugation, and excretion, which is the rate limiting step in hepatic bilirubin metabolism. So it was as far as I remember, it was excretion was the when the conjugated bilirubin get out of the liver cells membrane. So that was rate limiting or conjugation. So I'm confused between B and C. Uptake is definitely not a rate limiting step. So there is enzyme UDT transferase. So conjugation, I think, might be rate limiting. So and excretion occurred through OATP channel. And I'm not sure about this question, but I will mark conjugation because in these type of reaction, enzyme often plays the rate limiting step. So I will mark the conjugation and mark for review. A magistrate can pass an order for admission of a neglected mentally ill person for assessment for a maximum period of this. I do not remember reading it. This was there was 2017 change in Mental Health Act. So I think that question is from that side, but I do not remember reading it. So I will just skip the question. I do not want -1 for this question. What is the most likely diagnosis? They have given the image: 54-year female with cough and dyspnea for 4-year duration. History of anterior uveitis. So, symptom of lung plus anterior uveitis. Physician notes the general examination finding. What is? So, this is looking like sarcoidosis. This is lupus pernio. So, there are violaceous changes occurring at nose and this cheek. So, I will go for sarcoidosis. SLE may they do not give image of nose area. They just give sparing of nasolabial fold. They give very prominent red. So this is purplish. So this is lupus pernio, and I will go for sarcoidosis. Also, she also has lung symptom and anterior uveitis. So take care. Most likely enzymatic deficiency. General examination of 40-year-old male presents to the OPD. So they are given black discoloration of sclera and black discoloration of earlobes. So alkaptonuria. So alkaptonuria occurs because of deficiency of homogentic acid oxidase. HMG, no, this is for cholesterol. Alpha ketoglutarate, this is citric cycle. This cannot. PBG amylase, this will porphyria. So this is correct. What would a fracture of the ulna with lateral dislocation of radial head be classified as? A fracture of ulna with lateral dislocation of radial head. So they again this is Monteja fracture, and they have asked the classification of Monteja fracture. So I know Bardo's classification is used for Monteja, but they are given fracture of ulnar lateral dislocation. I do not remember the classification of Bardo, so I will just skip this question. What is the best drug for ovulation induction? So, 35-year-old female with primary infertility has acanthosis nigricans hirsutism. So, if infertility AN plus hirsutism pointing towards PCOD, USG shows PCOD. They have given the diagnosis. What is the best drug for ovulation induction? So, letrozole is used for off-label, but it is best drug for ovulation induction PCOS. So they are again letrozole plus metformin, clomiphene plus metformin, metformin only, letrozole only. So they ask the best drug. So best, I will go for letrozole plus metformin because I have read metformin increases the chance of ovulation induction. So metformin is a wonder drug for PCOD. So clomiphene citrate we also use it. Best is letrozole. It is off label, but it is used. So I will save it. Which of the following cancer cannot be prevented with Gardasil? So Gardasil is like a vaccine for HPV. So Gardasil have like 11, 16, 16, 18, and 6 and 11. Four strains. So cervical cancer definitely. Anorectal cancer, HPV causes anorectal cancer. Oropharyngeal cancer and colon cancer. So these are like squamous cell cancer caused by HPV. Colon cancer obviously cannot be prevented by Gardasil. It is not caused by HPV. Earliest immunoglobulin to be synthesized by the fetus is obviously it is IgM. You know this. IgG is transferred through placenta, and like IgM is synthesized first in fetus. So like many of the micro investigation for like congenital torch infection, they check IgM or transferred IgG. So this is like basic immuno question. So we have done the part. We still have 7 minutes. So we will just go through the questions which I marked for review. Glasgow outcome score for severe disability. So my thought process behind the question was like I remember there are five things. I'm just confused between like death is one or five. So like if one is death, two is comatose stage, three is severe disability, four mild, and five is like complete recovery. And like I remember it like this only. So I think three is looking correct to me. So I guess I will save it. Most common congenital heart wall defect is. I'm not sure about this question, like mitral stenosis, but like most common congenital heart wall, there is must be related to mitral wall, but I do not remember it will be stenosis or regurgitation. Bicuspid, I don't think like it is most common Turner, but overall it is not most common. Tricuspid stenosis, I don't think so. So like I have ruled out C option, but I am not sure between A, B, and D. So like we can go to skip the question. So I think I should skip it. I do not want that -1. So I have cleared the response. Ovulation trigger can be given when follicle reaches 18 mm serum. So B option was correct. It is given when serum estrogen is 200 per ml. Wala. Follicle, I am not sure like it was 12 mm or 18 mm. And they have given like other two options like any one of the above or both of the above. So this is, I'm sure this is like, I'm not sure about this option. So it can be both of the above. Any one of the above if this is correct. I will skip this question. Like, I do not remember actually. So ECG of a patient before major surgery, abnormality medicine consultation to comment on this ECG, likely explanation for ECG finding. So like ischemic heart disease cannot be because I don't think there is some. Yeah, they have given some elevation here. I think. Um, like I'm not seeing ST segment. ST segment elevation is seen in this condition, but like they have not given like chest pain, anything like that. This is just a normal routine investigation before the surgery. Cardiomyopathy is out. Ischemic, I'm like looking at ECG, it feels like it is ischemic heart disease. And hypertensive, I'm not sure what ECG looks like hypertensive heart disease. But like they have given like ST segment elevation. So I will mark ischemic heart disease and I'll just Like my gut feeling is like they have given ST segment elevation, so I will just go for ischemic heart disease and save it. Root value between first and second toe. So this is like deep perineal nerve, and I do not remember the root value. Like they have given only L4 difference, like L4 to S2 or L5 to S3, and this is originated from lumbosacral plexus. So like I remember it in between toes. There is like L4 component. So they are asking the cleft between first and second toe. So dorsal wall C and D options are out. We are thinking about A and B, and the difference is L4, L4 or S3. So like in between first and second toe, I think it is like L4 is supplying that area. So I think this might be right. And L4, I remember like deep perineal nerve, they have some like other value than the superficial nerve, peroneal nerve. So I will save it. Which of the following monoclonal antibody approved for angionotic edema? So this cannot be. C cannot be. We were confused between B and D. So like I honestly remember like canakinumab was in psoriasis and lanadelumab. Like Lana, I do not remember, but this thing I remember this was in psoriasis. So like A, C, and D options I have ruled out. So I think it's B. So I will save it. Diagnosed with chronic gastritis, which of the following complication may occur? So chronic gastritis complication, obviously we know atrophy will happen in chronic gastritis, in autoimmune gastritis. Dysplasia can occur in like chronic inflammation. This I do not know what is gastritis istica, but I think like all of the following complication will be seen in gastritis. I will save this question. Average weight gain in pregnancy poor Indian women. So like my thought process was like 10 to 12 kg is ideal, but they are asking like average weight gain in poor Indian women. So we know poor Indian women they will be less than 10. So 6.5 is looking correct to me. 2.5 is very less. 6.5 I remember. And it was like around 6 or 7. So like they are asking rate limiting step in there 48 seconds hepatic bilirubic metabolism. So I will go with conjugation like enzyme. I will go with enzyme. I do not remember this question. I will skip it, and I will skip also like lateral dislocation Bardow's classification 1, 2, 3, 4. Like I remember there was fracture of radial head in 4, but 1, 2, 3 they have gone 2A 2B also. So like we have skipped like 4 questions in this part. So okay, this is okay. Our target is like around 190 to 195. So like in 10 seconds, section C will start. So like for 10 seconds, just try to be relaxed before the new section start. Brody bursa lies deep to which of the following muscle? So this is lateral head of gastrocnemius. This is like an anatomy question. Which of the following fatal causes is likely in this case? A pregnant woman at 18 weeks of gestation has uterine size of 16 weeks on examination. USG show oligohydramnios. So likely cause for oligohydramnios. So anencephaly there will be polyhydramnios. Renal agenesis there will be oligo. Porter sequence is based on this only. Fetal anemia there will be poly. Twin there will be poly. So they are asking oligo and obviously there will be no urine production. So they will be oligohydramnios. What group of lymph node in the breast are included in external mammary group? Like internal mammary group is like near the medial side of sternum. External mammary group pectoral, central, apical, and lateral. I do not know this. Like, but pectoral group, I think this might be. I will mark for review. Which of the following monoclonal antibody approved for use in severe eosinophilic asthma? So, like natalizumab, it is used in ulcerative colitis. Mepolizumab is used in asthma. Nivolumab, this is like used in cancer or something. Muromonab, this is also like after organ transplant. So mepolizumab we have read in asthma. Other options are have been ruled out. What is the most likely diagnosis? 12-year-old child has a history of recurrent infection and bleeding gums. On investigation, the patient has pancytopenia and peripheral smear show macrocytes. Okay. Bone marrow biopsy showed no megakaryocyte but had fat-filled marrow. Recurrent infection, they will leukocytopenia. Bleeding gums, platelets are low. Pancytopenia, they have given macrocytes and they are fat-filled marrow. There are no like precursor cells. So this is like aplastic anemia. ITP, there will be only low platelets. PNH, there will be anemia. Myelodysplasia, there will be like no fat-filled marrow. So aplastic, there are no precursor cells. So, how is the diagnostic accuracy of a test is determined? So, diagnostic accuracy of the test depend on like, sensitivity, specificity, prevalence. Hmm, I'm not sure about this question, but like sensitivity or specificity are out. Predictive accuracy, diagnostic accuracy, prevalence. I will skip the question. In India, the age under which a boy is considered incapable of committing rape is like it is 18 years or no such limit. No, no, for a boy, which a boy is considered incapable of committing rape. So I don't think there is no such limit. We all know about like Delhi case. So 18 years for the girl, like for the consent. So I don't think there is any limit for the boy. What is the most likely diagnosis? Endoscopy picture of 73-year-old male admitted for evaluation of GI bleeding. So this is like watermelon stomach-like appearance. So this is looking like GAV, gastric antral vascular ectasia, because like there are red stripes. So watermelon stomach. So candidiasis, they will not go the picture of stomach. They will be like HIV patient with like esophagus endoscopy picture. Carcinoma stomach, they will be mass in eclasia. They will be they will give like barium study, not like endoscopy. So you can rule out these options and give obviously is the answer for the question. They have asked about the diagnosis. 16-year-old boy referred to a tertiary hematology center as a bone marrow failure syndrome. Hematologists make an observation of the following finding in the image. What is the most likely diagnosis? So they have given like some lesion on tongue. There is like some lesion on the neck. It is not very clear. So I will read the option. Pure red cell aplasia. SLE, discretosis congenita, chronic abscess infection. So like bone marrow failure plus like there are like nail, tongue, and like changes on neck. So like some ectodermal defect. So pure red cell aplasia, you do not see like these kind of features, like tongue and this kind of feature. SLE obviously cannot happen. Chronic abscess infection, there is like no bone marrow failure or like these kind of changes. Lichen planus we can see in chronic abscess infection, but like I don't think like there are some tongue and nail lesion. Discretosis congenita, this is looking right. Like I have studied this condition in like bone marrow failure syndromes, and discretosis obviously implying like epidermal defect, some like changes will be in skin, nail, or hair. So this is the best option. I'm think. Which of the following is false regarding the condition? A pregnant woman with a fibroid uterus and 26 weeks of pregnancy develop acute abdominal pain with low-grade fever and leukocytosis. Which of the following is false regarding this condition? So like in the pregnancy, there is a fibroid, acute pain plus fever plus leukocytosis. So this is like a red degeneration of the fibroid. So they are asking false about the condition. It is due to vascular thrombosis. Like red degeneration occurred due to thrombosis, I'm not sure. There can be rise in ESR. Obviously, WBC and ESR like a mild elevation will be seen. Expectant management is done, can be helpful. Patients should undergo myomectomy. No, we do not go like myomectomy for red degeneration. It just get resolved with like some PCM and like painkiller. So there is no role of surgery for red degeneration. What is the diagnosis of the patient? 56-year-old postmenopausal patient has acute abdominal pain. Uterus size is 12 weeks by per vaginal examination. She had no complaint before this. USG was normal 5 months ago. Okay. So what is the diagnosis for the patient? So this is like postmenopausal women or uterus size is also increased. 12 weeks. And 5 months ago, her USG was normal. So like degeneration of the fibroid cannot like previous there will be previous complaint. Adenomyosis, like postmenopausal women plus 12 weeks uterus is making me think about adenomyosis, uterine sarcoma, and broad ligament fibroid. So fibroid cannot be the answer of this question. I'm thinking about adenomyosis and uterine sarcoma. So this he has acute abdominal pain. Uterus is 12 weeks by per vaginal examination. No complaint before this. Like adenomyosis, like average age is he is like around 40 years. He is like postmenopausal 56-year-old, and 5 months ago USG was also normal. So like rapid increase of symptoms is making me think about the like cancer. So it might be uterine sarcoma, but I will just mark it for review. Which of the following is the most likely diagnosis? 74-year-old women present with inability to walk after fall at home yesterday. So like old female. On physical examination, the left leg is shorter than the right leg. Injured extremity in abduction slightly externally rotated. Which of the following is the most likely diagnosis? So like they have given shortening of the leg, extremity in abduction, and external rotation. So this is Faber. Like slightly external rotation is making me think like neck of femur fracture. So fracture of the femoral neck. The tibia fibula, no. They will be like this posture won't be seen in those conditions. Like this is a typical history given in neck of femur fracture. Many spatial microscope used in field of microbiology all have special uses. Dark ground microscopy. So dark ground, like when I read dark ground microscopy, I just remember syphilis actually. So it is used to see capsule. No flagella. I don't think so. Fimbriae, the fractile organism. So in dark field microscopy, like syphilis, like organism, it cannot be seen by light microscopy. So I think it is the fractile organism. The capsule, flagella, and fimbriae cannot be the answer. So I think this is the answer. Most common cause of renal artery stenosis in young adult in Western countries. So like renal artery stenosis, they have given young and also Western countries. So like fibromuscular dysplasia, I think the most common in Western country. If they ask about like Indian or like Asian countries, so Takayasu is most common in young adults, and in old people, atherosclerosis is most common. So I think in Western country, fibromuscular dysplasia is the most common cause of renal artery stenosis. Tocilizumab is FDA approved in the treatment of tocilizumab is, we use in giant cell arteritis. So we only read this in giant cell arteritis. Takayasu, like we use, like I remember using tocilizumab in Takayasu arteritis, but FDA approved, I think like in giant cell arteritis is more better option. Wagner's and polyarteritis nodosa, I don't think we use this. So FDA approved, I think it is in giant cell arteritis. Transpyloric plane passes through all of the following structure except. So pylorus of the stomach, transpyloric, the name says itself. Hilum of the kidney, yes. Neck of the gallbladder and the neck of the pancreas. So neck of the pancreas is correct. Hilum of the kidneys like hilum of the uh, kidney is okay. Pylorus of the stomach is definitely fine. Like I think this is not the neck of the gallbladder. I think this is like the fundus of the gallbladder from which the transpyloric plane passes. Uh, I do not remember exactly what was it, but I think I'll mark neck of the gallbladder. I will review it later. Typical spatial histology type seen in triple negative breast cancer. So it is like medullary you see in BRCA, triple negative cancer, and medullary cancer you see in like BRCA cancer. So triple negative medullary. So this is a very long question. Which of the following is the most likely diagnosis? 45-year-old women noted increased fullness in her neck for past 8 months. So something to do with like thyroid. On physical examination, thyroid gland is diffusely asymmetrically enlarged and nodular. She undergoes thyroidectomy. Gross examination of thyroid, so multicentric thyroid neoplasm. Microscopically, neoplasm is composed of polygonal to spindle-shaped cell forming nest and trabecula. There is a prominent pink hyaline stroma that stain positively with Congo red. So, like Congo red staining plus thyroid mass points toward medullary thyroid cancer (MTC). Electron microscopy also show intracytoplasmic membrane-bound electron-dense granules. So, our finding is confirmed. This is like medullary thyroid cancer. So, you can just do this question with thyroid neoplasm plus Congo red. So, medullary thyroid carcinoma will be right answer. Papillary follicular, you do not see like Congo red positivity. Which of the following drug should be given to the patient? 75-year-old male patient was operated for prostate cancer. During surgery, local mets foci were noted. Which of the following drug should be given? So like in metastatic prostate cancer, desmopressin you will not use. Leuprolide you use, like it is growth GnRH agonist, you give continuously for in prostate cancer. Tamsulosin is given in BHP. Octreotide no link with like prostate cancer. So leuprolide is given in metastatic prostate cancer. Diagnosis of the patient: 30-year-old G6 P5 A0 L5 patient. So, okay, came with labor pain. Examination: there is pallor and icterus with blood pressure of 160 by 90. Laboratory investigation: hemoglobin is 7.3. Platelets are 75K. SGPT and LDH is 1200. Serum creatinine is 2.0. Definitely, this is increased. PT is 18 and INR is zero point 0.9. There is absent fetal heart sound on per abdomen examination. What is the diagnosis of the patient? Uh, she comes with acute labor pain. There is pallor and icterus, obviously jaundice. There is some problem with liver. BP is also increased. Platelets are low. Hemoglobin is low. SGPT is increased. LDH I do not know. This is increased or not. Serum creatinine is increased. PT is normal. So, what can be the diagnosis? Chronic renal failure cannot be the answer. DIC, I don't think so. HELP syndrome. So, like HELP, like hemolysis, there is low hemoglobin. Okay, low platelets, 75K is low, and elevated liver enzyme. So, this is HELP. It's like they have given like low hemoglobin, so obviously hemolysis is going on. They are given LDH value. So, like LDH, they give only for like hemolysis, and it is increased. Liver enzyme they have given, and also like PT is normal, so DIC cannot be the answer. So I think HELP syndrome. If there was a rupture placenta, there will be like some like other history, and they won't give these values. Bleached discoloration of gastric mucosa is seen with poisoning. So there is blue, there is copper sulfate. It I remember, but there is no option of copper. So lead, cadmium, amityl sodium, and arsenic. So this is a PYQ. This is a NEET PYQ, I think. So amityl sodium changes the like gastric mucosa to blue. So direct PYQ question. Repair of the peripheral one third of the meniscus is sometimes possible because it has the following characteristic. So like meniscus, when we do meniscography, there is in the center there is like white part, no blood supply, and in the periphery there is red part. So there is a increased blood supply. So sometimes we can repair. So I think it is increased blood supply. It is called red zone of the meniscus. So okay. Which of the following is example of multiphasic screening? Chest X-ray for TB in large population, annual health checkup, pap smear in old females, mammography in old young females. So multiphasic, like there will be like some phases. You do like more than one investigation for the screening. So only X-ray cannot be. Annual health checkup, you do like so many tests for the people, and like if something is wrong, then you further test for something else. So more than one in annual health checkup, it is okay. Pap smear is only one investigation. Mammograph is only one investigation. So this cannot be multiphagic. Annual health checkup will be multiphagic. According to WHO, what is the minimum number of ANC? 8. So this is like basic ratta question. Government of India says 4, WHO says 4. 8. WHO says 8, Government of India says 4. Septic shock is due to MBBS student went for medicine posting first time. He saw a patient with low BP, dizzy, confused, and with diarrhea, nausea, vomiting. PG student told him this was a case of septic shock. So like this is just for wasting your time. They are just going to a septic shock is due to like septic shock occur in like gram negative septicemia like lipopolysaccharide causes septic shock. Cremastic fascia is derived from which of the following structure? So cremastic fascia it is derived from internal oblique muscle. Like there is no role of transverse abdominis. External oblique form the like external most layer. Cremastic fascia is in between. So in between is by the internal oblique. Um, okay. A child comes with a feature of coarse face, hypercalcemia, and cardiac murmur of aortic stenosis. What is the most likely diagnosis? So, like they have given facial feature, hypercalcemia plus aortic stenosis. This is Williams syndrome. Like typical, they have given all the features of Williams syndrome. So, Prader-Willi angina cannot happen. Angina will be like puppet. Prader-Willi, there will be fat boy. Dijor syndrome, there will be like immunodeficiency and like heart defect, not aortic stenosis. What is the most likely diagnosis for the man? 35-year-old man presents with the 3-month history of pain and swelling to total distal DIP joints on the right index and left ring finger, diffuse swelling and pain of great toe. So they have given like pain of DIP and great toe. So when I hear great toe, gout comes to my mind. He has intermittent rash on the scalp and elbow since he was a teenager. So derma plus joint pain, psoriasis. Okay. Which is not present currently. Laboratory investigation show a normal complete blood count. Blood chemistry panel. Sedimentation rate is increased to 40 and CRP is increased to 10.7, which is the most likely diagnosis. So, like it was if it was gout, so there will be no history of like rash of the scalp of elbow, and there's a history of DIP joint involvement, grade 2, okay, and like rash. So it is kind of psoriatic arthritis. Rheumatoid arthritis, these skin features won't be seen in like Lyme disease, this will be acute, no skin rash of this type. Gout, rash won't happen. So psoriasis is the right answer for this. So what is the best next step in the management of the patient? 34-year-old woman presents with a history of uncontrollable urge to move her legs, so looking like restless leg syndrome, which occurs every night while lying in the bed. Stretching her legs on walking often temporary symptomatic relief, although sleep initiation is affected. She provides a history of heavy menstrual bleeding, neurological examination, one normal for lower limbs, including motor strength, reflex, sensation to vibration, joint position, pinprick, and temperature. What is the best next step in the management? So like this is the case of restless leg syndrome. So next best step we do like there is an association of iron deficiency anemia and RLS. So I might want to check, they have like given some investigation, so I might want to check her ferritin level to check for iron deficiency anemia. um, so also they have given like heavy menstrual period, so this is correlating, so this is right. 45-year-old male has massive splenomegaly with myeloid hyperplasia. What is the next best step to confirm the diagnosis? So, like massive splenomegaly, myeloid hyperplasia, this is CML. So, for CML to next best investigation they have asked. So, fish is the best investigation to confirm the CML. Identify the following image. So, I cannot see this image what they have given. I do not remember this image. Let's see the option. Mirena inserter, implanon, nexplanon, and uh, Cyana press. So, like, I have no idea what is this is. So I'm gonna skip the question. All of the following are disadvantages of mediolateral episiotomy except. So, like, it cannot extend to rectum mucosa, rectal involvement. So this is the only advantage of mediolateral episiotomy. They have asked all are disadvantages except so blood loss is more, positional not dyspnea is more. There is no rectal involvement is mediolateral, so we do this. All the following can be done for his treatment except 12-year-old boy with a symmetric expansile cystic lesion in proximal humerus. So when they give proximal humerus, there is a cystic lesion. This is like simple bone cyst. All the following can be done. So curata is intralesional steroids, intralesional sclerosing agent, radiotherapy. So simple bone cyst is not a cancer. So it is not malignant. So you will not do radiotherapy for this boy. You can simply curata, or you can do like injection of steroids or alcohol or like some other sclerosing agent. So like you can obviously choose this option like radiotherapy is not for simple bone cyst. Which of the following best describes the role of zinc fingers in biochemical process? So zinc fingers it is actually related to DNA. So no carb metabolism, no electron transport chain, no antioxidant. They are involved in the regulation of gene expression by binding to DNA sequence. So you even just know that zinc fingers are involved in DNA, like we read in genetics, biochemistry genetics. So you can do the attempt the question. Which of the what will be the classical histological finding? 50-year-old male has recurrent UTI. Cystoscopically, soft yellow, slightly red mucosal plaque, 3 to 4 centimeter diameter were seen. What will be the classical histological finding? So they have given like mucosal plaque. So I'm thinking about like malakoplakia, recurrent UTI plus 50-year-old male plus like this is yellowish. So I think this is malakoplakia. So in malakoplakia we see Michaelis Cutman body. HPV has nothing to do with bladder. You can rule out this option. Actin bodies like I haven't read anything like this in like urology, urosurgery actually. Hirano bodies it is related to CNS, like it is seen in like I think Alzheimer's. So you can obviously rule out three options, and this is obviously the correct answer. Which of the following CNS cell types express both CD4 receptor as well as CCR5 and CXCR4 receptors? Hmm. So, like a 42-year-old HIV male had a confusion, drowsiness, episode of unconsciousness, had a fever and neck stiffness. Mild lymphocytic meningitis was suspected. So, like they are asking which CNS cell both the receptors CD4 as well as CCR5. So, like I am not sure about this question, but like when I read HIV in CNS infection in path, there was something mention of microglial nodules. So, like if there is microglial nodule formation in HIV, so I think microglial cell should have like both receptors because we do not see read about like oligodendrocyte or astrocyte or ependymal cell in HIV CNS infection. We actually read about microglial. So this is just a pure guess. So I will just mark it and mark for review. I will see it later time. COPD patient FEV1 50 to 80% of predicted falls under which severity of airflow limitation. So gold classification, classic NEET question. So 50 to 100 is like 80 to 100 is 1, 2 is 50 to 80, 3 is like 30 to 50, and below that is gold 4. So which of the following is not included in the immunological domain in the 2019 ECR ULR criteria for SLE? So like these this criteria there are like 11 domains in this thing. I do not remember them all, but let's see the option: direct Coombs test, antiphospholipid antibodies, complement proteins, SLE specific antibodies. So ANA and SLE antibodies are there in like laboratory criteria. This is in the laboratory criteria. Direct Coombs test or complement protein. So like I don't remember reading complement protein in SLE criteria. Direct Coombs test, I think this was there, but like I'm not sure about the full criteria. So I will just mark for review. Which of the following adverse effects is likely to be due to psychotropic drug inhibiting the reuptake of serotonin? So this is like SSRI, likely to happen adverse effect. So like inhibiting the reuptake of SSR, I say sexual dysfunction होता है. So this is a side effect of sexual dysfunction. Seizures, I don't think. Weight gain, I do not remember. I think it was weight loss, so side effect in SSRI. Dry mouth, we more likely seen like TCA. Like amitriptyline is famous for causing dry mouth. So sexual dysfunction obviously side effect of SSRI, and they are asking about a drug which is inhibiting the reuptake of SSRI, so selective serotonergic reuptake inhibitor. So ठीक है, SSRI side effect is sexual dysfunction. I do not like know about these three options, but I am sure about this option. Sexual dysfunction occur in SSRI side effect. So I will mark this. When assessing a child with vomiting, which of the following statement is true with respect to vomiting in a child? Projectile vomiting is the diagnostic of pyloric stenosis. Green colored vomiting is in a newborn is a sign of gastroesophageal reflux. No. Vomiting is a presenting symptom of raised intracranial pressure. Cow milk protein intolerance does not cause vomiting in breastfeed babies. So they are asking about the true with respect to vomiting in a child. So projectile vomiting is a diagnostic of pyloric stenosis. The projectile vomiting is seen in like when there is increased ICP. In pyloric stenosis, I think there was non-projectile vomiting, non-bilous. I'm not sure about this. Green colored vomiting is sign of gastroesophageal reflux. No, if it is green colored, it is bile stain. So it is like fluid secretions are coming from the duodenum to like in the stomach. Gastroesophageal, no, they will won't be green colored vomiting. Vomiting is the presenting symptom of raised intracranial pressure. This is right. Cow milk intolerance does not cause vomiting. I think it might cause. So projectile vomiting is diagnostic of pyloric stenosis. So like we can see projectile vomiting in pyloric stenosis, but I don't think it is a diagnostic. And this option is looking more correct to me. Like vomiting is a presenting symptom of raised ICP. So like I'm sure about this option. I'm not sure about other three options. So I will go with this. So there are 13 minutes remaining. We will just review the questions. Which group of the lymph node in the breast are included in external memory group? Uh, so like I do not know about this thing, but like there is internal memory group which is like parallel to the lateral border of sternum, and like pectoral group drains like most of the breast. So external memory group, I think pectoral group will be like cold. It drains most of the breast. Central is like the last final destination. Apical, this is like pectoral is central, then central to apical. Lateral, like it is mostly drain the like upper limb. It has very less percentage in like draining the breast. So in external memory group, I think it will be pectoral group, and like I think this is right. So I will save it. Diagnostic accuracy of a test is determined by. Like I remember studying it, but I do not remember like sensitivity, specificity, PPV, and NPV. Diagnostic accuracy of a test is determined by. So like they have given both the like sensitivity and specificity. So like if any of if uh, like this was the answer, sensitivity, like sensitivity and specificity go like side by side. So this B and C I think cannot be the answer to this question. Like they cannot be like cannot mark sensitivity without specificity. It will be both if I mark them. So I think B and C are out. Predictive accuracy, diagnostic accuracy doesn't looking good. Prevalence, I think it is okay. So like diagnostic accuracy of a test can be determined by prevalence. I'm not sure. I'll just review it at a later time. So this was like postmenopausal women. There were no symptoms, and like there is a like rapid growth of like uterine size, and USG was 5 months ago. This was normal, and in 5 months it has grown by like it has become 12 weeks, and there is a rapid symptoms and acute abdominal pain, and also her age is 56. So I was confused between adenomyosis and uterine sarcoma, but like against the adenomyosis, the points are like adenomyosis seen in like 40 to 45-year female. There will be history of dysmenorrhea, and like this won't be like this rapid 5 months. So I will go. These all features are going in favor of uterine sarcoma. So I will mark this like this is looking right to me. Transpyloric plane. Pylorus of the stomach is right. Hilum of the kidney is right. I'm sure about A and B. I'm just not sure about it was like neck of the gallbladder or like it was fundus of the gallbladder. Neck of the pancreas is looking right because like transpyloric plane we see formation of like splenic vein. So it just forms at the neck of the pancreas. And obviously transpyloric plane it goes through like some part of duodenum and neck is also in that area. And like I kind of remember like reading it was fundus of the gallbladder, no, neck of the gallbladder. So I will just mark this. This image I do not know anything about it, so I will just skip it. So there is HIV, and so the thought process behind this question was I haven't studied any of like oligodendrocyte, astrocyte, or ependymal cell are out of the equation. There is no link of HIV in this. Astrocytes and oligodendrocyte, like I haven't read actually. Like I remember only reading like there is a formation of microglial nodule in like HIV brain, and they're asking like which CNS cells are both the receptors. So like if the microglial cell are both the receptor, it will infect those cells and microglial will form the nodule. But at the same point, the microglial, this can be only just a reaction to infecting other cells. So I'm not sure about this thing. I want to mark microglial because I think it is like right option. So I will just go with my gut feeling. I will mark microglial cell. Which of the following is not included in the immunological domain of ACR-ULR criteria? So ANA and SLE bodies are definitely there. Antiphospholipid antibodies is definitely there. Direct Coombs test and complement proteins. So like I do not remember studying complement protein anywhere in the criteria. I remember studying like direct Coombs test, but I remember like it was removed from the like updated version of the criteria, something like that. But I'm just not sure it was like 2019 or update happened like before it or after it. But complement protein, this is not looking right. So I don't think complement proteins are included in any of the criteria, old or new. So I will just mark it. I'm confident about this option. So we have marked like this question also. So diagnostic accuracy of a test is determined by. So prevalence might be the answer, but I'm just not sure. Like I want to mark the prevalence as answer because like sensitivity, specificity, यदि answer होता तो both will be the answer or none of them will be the answer. So B and C cannot be, and like predictive accuracy and diagnostic accuracy doesn't go like doesn't look right. So I remember diagnostic accuracy is linked to somewhat like prevalence. More the prevalence, they will be more be like accurate the test. So I will just go with my gut feeling. I will mark this. So we have skipped like this question, and I do not have any idea. Like it is some kind of like for inserting into the skin. So implanon, nexplanon are the same thing. Just some like I haven't seen. So I will just skip it. So we still have 6 minutes. So in the meantime, you can just fast review all the questions. So Brody Barsa, they've asked the muscles. So these kind of questions like anatomy is काफी volatile subject. You must read these volatile subjects in the last week before the examination. So I kind of remember like in lateral gastronomy, Brody was there. So this is right. They are given like fetal cause, oligohydramnios, just match the option renal agenesis, no urine, oligo. So this is correct. This I guessed external memory group, pectoral. This was just a wild guess, but I think like pectoral is the most important. So they will give a specific name to like only the most like important group of the lymph node. So monoclonal antibody, asthma. So we have ruled out like other options, and we remember reading it like in asthma. It was like IL-4 or 5. I remember it. It was against IL-5. So I will mark this option. There is a child with recurrent infection, pancytopenia child, and macrocytes. Bone marrow show no megakaryocyte, but fat-filled marrow. So fat-filled marrow gives the diagnosis of aplastic. So we have seen this question. So like A is for a boy is considered incapable of committing the rape. So I think this there is no such limit in India. So this is gay. So like in the meantime, you should try to do that questions like table type or sequence type of question, because sometimes we, while knowing the answer, while choosing like the correct option, we mark it wrong because of like A B C D 1 2 3 4 matching type of questions. So you should focus more on that last minute of the section if the time remains. So this question, I had just some idea like this is bone marrow failure plus some skin like ectodermal changes they have shown. Like there's some tongue defect and some nails and skin changes. So pure red cell aplasia, I do not remember like these skin changes. Hep C and SLE cannot be answers. So these are pakka ruled out. And discretosis is slightly I am going in this favor because like I have read this condition in like bone marrow failure syndrome, and like there's some ectodermal defect, and like the name also saying like discretosis, something to do with like keratinization of like epidermis vagera, and congenita obviously a 16-year-old boy. So I do not remember about this disorder. I just remember I read it in bone marrow failure syndrome. So I think this will be the right answer. So fibroid, pregnant, second trimester, acute pain, fever plus leukocytosis. So surgery, they have asked the false. So there is no surgery for this condition. We have seen this question. So a old female, there is a like fracture suspected, leg is shorter, and abduction slightly external rotation. So neck of femur fracture. That will be the correct answer. So they've asked about the dark ground microscopy. So I do not like remember all the stuff, but dark ground microscopy used in like syphilis. You see like thin slender organism with it. So capsule flagella fimbriae, like capsule के लिए you stain, flagella के लिए there are different stains. Fimbriae I don't see you. Fimbriae only seen like electron microscopy. So like a fractal organism like syphilis you see by dark ground microscopy. Most common cause of renal artery stenosis in young adults in Western countries. So this kind of question you should read it complete. They've asked most common renal artery stenosis, young adults, that too in Western countries. So fibromuscular dysplasia. This was like South Asian countries. So like Takayasu is the most common cause, but like they haven't given like atherosclerosis or Takayasu. So there is no confusion in this question. SLE, PN does not cause. PN can cause, but like no, most common. Wagner's doesn't cause. Tocilizumab FDA approved. So like tocilizumab we use both in Takayasu and giant cell arteritis. But like they have asked FDA approved, so I think giant cell is more correct option because we frequently use like after steroid we use tocilizumab in giant cell. So FDA approved, I think this is the answer. This we have seen. So this was like triple negative breast cancer and histology image. So triple negative medullary BRCA. So with the BRCA connection, you can solve this question, even if you do not know about like other these options. So we have seen like any neck enlargement stains is Congo red. You just have to think about MTC medullary thyroid cancer, and they also give like one positive finding of like electron microscopy. They have granules. Prostate cancer. So these drugs have no connection to prostate. Like even these drugs are not read in like neurosurgery in prostate chapter. So you just can like tamsulosin using BHP not related to any cancer. These A and D obviously are ruled out. So leprolide is the right. So we have like 36 seconds remaining. We have done all the questions. One question we skipped off that emails. I didn't know. So for 30 seconds, in 30 second next section will the start. So we will just wait for the next section. The root of mesentery crosses which of the following structure? So root of mesentery crosses the structure like left ureter, left psoas major, IMA, and inferior vena cava. So like left ureter, left psoas major, and IVC is crossed by the root of mesentery. It goes from like from the left to the right side, right SI joint. So IVC aorta is obviously crossed and psoas major, left ureter are there. Root of mesentery crosses which of the following structure? No, this should be like right psoas major and right ureter. IMA, I am not sure what this is. IVC is definitely closed by the root of mesentery because it goes from left side of the body to the right side of the body. So obviously it will go through the midline, and IVC is in the midline of the body. So they are given like right change this thing. So I think it is IVC. Which among the following condition show greenish discharge from the nipple, duct ectasia? So this is like simple table from this like discharge versus disorder of the breast. Papilloma, you see bloody discharge. Fibrocystic, they are like clear serous discharge. Interductal cancer, they will be bloody discharge. Which among the following carries slightly increased risk of invasive breast cancer based on the pathological examination of a benign breast tissue? So, like they are asking about if there is any risk in this benign condition. Fibroadenoma, no risk of cancer. Atypical hyperplasia always carries like some risk of converting in future into cancer. Radial scar papilloma, they are completely benign condition. So like this question is from like that Robin's table. They have given compared the condition versus relative risk of the condition happening converting into cancer. So atypical hyperplasia, I think it was RR was 3.9 around like 2 or 3. So obviously this has risk of invasive cancer. Which one of the following bacteria is classified as facultative anaerobe? Pseudomonas, we all know it is like it requires oxygen all the time. It is not anaerobe. Bacteroids are not facultative, they are like mandatorily anaerobe. Escherichia coli is facultative anaerobe. Clostridia are anaerobes. They like cannot survive in oxygen environment. So this is like basic knowledge about some organisms. Which of the following curvature are primary in the nature? So like there are two curvature in the spine, primary and secondary. Primary are those of like uh, embryological thing, and secondary I think after like being born we develop the curvatures. So primary curvatures I think thoracic and sacral curves are called thoracic and sacral because like it is convex on that side is like the embryo. So this is primary. Cervical and lumbar are secondary. So I'm mild confused in this thing, but I think this is the correct. Like convex outside, thoracic and sacral. These are primary and others are secondary. 10-year-old child presents with generalized edema, urine protein plus 3. So this is kind of nephritic picture. Serum cholesterol 250, obviously nephrotic. Urine examination show oval fat bodies, nephrotic syndrome. What is the diagnosis? So a child with just nephrotic syndrome, hypercholesterolemia, oval fat bodies, this is nephrotic syndrome. Nephritic may you will see some blood, good posture, lung involvement, UTI. So there will be no like plus 3 protein UTI. What is the position of appendix in silent appendicitis? So basically like anatomy and surgery question. So I think in post-ileal we see minimal symptoms. Post-ileal there are minimal symptom of appendicitis. Retrocecal most common pelvic there are like some pelvic symptoms. Subcecal there will be symptoms of appendicitis. Post-ileal rarely there are symptoms, just symptoms of like pain around umbilicus. silent appendicitis, I think post allele is called that. Which of the following is the most useful method to combat digitalis cardiotoxicity? Most useful method. So, like we give Dizibind is a specific drug for digitalis. So, most useful, I will go with Dizibind. So, this is specific for digital toxicity. Most common site involved in tinea cruris infection. So, like if they are saying cruris is for like inguinal area. Bearded area is called barbe. Scalp is called capitis. Armpit, I don't think, but armpit, I guess, body of like it is called tinea corporis. Cruis is like Jokic inguinalism. Civate body are seen in which of the following? So Civate body, I remember, it is seen in LP, lichen planus. So pemphigus, you see like Civate bodies, there is no mention in pemphigus. Psoriasis, you do not see Civate body, you see like that camel foot appearance. Lichen planus, you see just basal cell degeneration, and there is a formation of Civate body, like they are round bodies. That pictures are also important. And there is some like after basal cell degeneration, there is a max space also generates. कि बेजल सेल डिजनरेट होने के बाद स्पेस बन जाता है so Civate body I think it is an LP. Safe method for disposal of mercury. So this is like a PYQ question. So safe method for disposal of mercury: collect carefully and recycle. Control combustion, no, we do not combust like heavy metals. Treatment with chemicals. Deep burial is not the answer. You won't leave like heavy metal in like in deep burial. So B and D have been ruled out. A and C, I'm confused. Like we can treat it with chemicals, or we can collect carefully and recycle it. Uh, so recycle, I do not think is the correct answer. We like these kind of like chemical mishap occur. We like just treat it like chemicals to neutralize it. So I'm not sure, but I will mark it for you. All are incinerated except so yellow जो waste box is those things are incinerated. So anatomical waste going to yellow, animal waste going to yellow, infected solid waste and broken ampules. So broken ampules go into blue. So you will not incinerate, you will not burn those ampules. You will like you can recycle them. Infected solid waste obviously come into this category only. So you burn those things, they are infected. Mild poisoning by organophosphate occur when the cholinesterase activity is. So I do not remember like this mild, moderate, severe criteria of this. But I just remember less than 50% when is the activity, we say poisoning by organophosphate. So definitely less than 50 will be the answer. So 50 to 75 cannot be the answer. 20 to 50, 10 to 20, and less than 20. So I think if less than 50, so mild hai, so 20 to 50 will be mild. This will be moderate. This will be the severe. This is just a wild guess. I will just mark it for review. ECG below is the diagnostic of. So this is a very small picture. We can zoom actually. First, there is a first degree heart block, Mobius type, and complete heart block. So you just see the lead number 2, which is given at the like bottom corner. So you just see each P and QRS complex. So there is PQRS, PQRS, PQRS. This P occurred, but no, this PQRS, and then no QRS. P. So I think like there's like QRS after every P, but there's suddenly after P after this P, the QRS complex dropped. Then again it started, and like this obviously time is also increasing PR interval. There also again happened after the 4 QRS complex. So I think it is Mobis type 1, the Wanky batch phenomena. PR interval increasing, then suddenly one QRS is dropped, then the cycle repeats. So I think it's Mobis type 1. So like these kind of ECG questions, just rely on the lead number two, which is given at the bottom. Do not see like first see this lead, and after getting this lead, you can go above, because in the bottom lead they will go so many QRs complex. So you can just by it. So I will mark movies type one. Most common chronic dermatitis in lupus is. So I think it's like DLE happens. Erythema marginatum is not seen in SLE. Malaris is acute dermatitis, not chronic lupus pernicious sarcoidosis. So other three options are ruled out. DLE is obviously most common chronic dermatitis in lupus. All of the following are true about SUI, except SUI is stress urinary incontinence, abnormal uroflowmetry, Q-tip test positive, bony test positive, leak point pressure test positive. So I know in SUI Q-tip and bony test is positive, but I don't think there is some abnormal uroflowmetry in SUI. Like this finding is seen in like other urinary incontinence, not in SUI. SUI just occurs because of like some laxity of tissue around the urethra. So like urethral hypermobility causes Q-tip and bony to be like more formation of the angle. So these tests will be positive. Leak point pressure test is positive. I do not know this, but I am sure about this option. There will be normal uroflowmetry in SUA. Vaginal epithelium is derived from. So vaginal epithelium will be from the epithelium of the sinus or genital rays. Genital rays say like ovary develops. So this C and D are ruled out. Mesonephric forms male parts. So it cannot be the answer. Like obviously doesn't form the vagina. So epithelium of the urogenital sinus forms the like upper two-third of the vagina. Lower one-third is formed by something else. So this is the correct. Other way I can rule out. Mesonephric is for males, M is for M. And genital is forms the ovary. No, nothing to do with the vagina. All of the following are complication of the injury, except so 32-old male, emergency department, severe elbow pain and swelling. X-ray was taken. So in X-ray, there is some elbow dislocation. I cannot see the like some fracture lines. Uh, so like this cannot be like supracondylar fracture because this is a grown-up man. Supracondylar fracture is seen in some like 12, 14-year-old boys. So I'm just thinking if this is the elbow dislocation. So this is dislocated, I think. In elbow dislocation, you can see myocytic median nerve injury, brachial artery injury, radial nerve injury. So in elbow dislocation, you can see median nerve injury, you can see brachial artery injury because these are just around the elbow. You also can see radial nerve injury. But myositis ossificans, was a complication of like supracondylar fracture of the humerus, which is seen in child, not 32-year-old male. Or I cannot, obviously, I cannot see like supracondylar fracture of the humerus, some fracture line. This is looking normal to me. I just think it dislocation and dislocation में myocytic ossificans is less likely. बाकी other three things can happen around the elbow. Most likely agent is a man presents to STD clinic with urethritis and urethral discharge. Gram stains have numerous pus cell and organisms. This is a cliche line. Like this has been repeated so many times, and this question was also asked in May INI this year. So this is like no organisms and but pus cells. Culture is negative on routine media. So what will the most likely? So this will be chlamydia. You will see only pus cells. You will not see any of the microorganisms. So obviously routine media you cannot grow chlamydia. It requires some specific like those culture cells. All of the following are pillar of primary healthcare. So there are four pillars. Uh, it was like equitable distribution, community was participation was okay. Health education, I do not think this was in the pillar. Yeah, this was definitely in the pillar, intersectoral coordination. So there were four pillars like equitable community participation, intersectoral coordination. One thing was also there, but health education, I do not think that was in the pillar. In which situation it is considered that the emphasis has shifted from urban to rural services? Ah, the last part was applicable technology. They are given in the next question itself. So, like sometimes it also happens in the same section. Two questions are asked from the same topic. So sometimes you can take help from the second question and like answer the first question or correct it. So emphasis on from the urban to rural. Like technology has, I don't think nothing to do with like urban to rural shift. Intersectoral coordination is just like the like coordination between the ministries and other departments. Community participation, rural as well as urban. Equitable distribution is sounding like nice because like our past health infrastructure has emphasis on like urban structure and they are saying like there should be equitable distribution. Those who are more needy should have more like access to health infrastructure. So I think equitable is just doing justice with like urban to rural service. Blue line is not are not seen in poisoning by. So there was a mnemonic for this like limca. So arsenic में UC blue line, mercury limca UC in mercury. Silver I do not remember. Bismuth poisoning में UC like black tongue. So I don't think like bismuth will cause blue lines. It will cause like blackish tongue. You see in like pharma bismuth के side effects. So like I'm sure about this option. Arsenic causes blue line. Mercury causes blue line. I do not know about silver, but I know bismuth doesn't cause blue line. It causes black. Or paralysis occur due to involvement of. This is like 6 point in brachial plexus C5, C6 upper trunk, obviously. So there are only two like congenital palsy. Clump is CAT1, upper trunk ARPS is C5, C6 upper trunk. Lower trunk is clump. Middle of medial cord there is no like congenital palsy we read. Monro microabscess formed in which layer of epidermis? So uppermost layer of the epidermis is seen in psoriasis MP, Monro microabscess seen in psoriasis, and it will be formed in the stratum corneum. So some histopathology image. Let's read the history first. 62 traffic policemen present with slowly enlarging pearly pink papule on the right ear. Later become ulcerated. So image from the biopsy shown below, what is the most likely? So like this is 62 traffic policemen, very much exposure to sunlight can cause skin cancer. Slow enlarging pearly pink papule. So pearly pink papule, like it is like feature of basal cell carcinoma. Obviously, the right ear position is like it is aligning with our thought. It later become ulcerated. So like it is a typical feature of BCC to like it does not metastasize. It just locally invade and ulcerate. Image from the biopsy. So I'm just not good at reading the histopathology image, but like I think this is like palisading they have shown. Like this is the palisading. So palisading is obviously feature of BCC and history obviously telling about BCC. So I will just go with basal cell carcinoma. According to USPSTF, I do not know what is this. Screening of cervical cancer starts at the age of. So like 21 जो फेडरेशन ऑफ गायनेकोलॉजिस्ट ऑफ लाइक यूएस है that says about 21 and WHO says third and fourth decade. So like US, so I think that 21 year they want to ask. 30, 35, 20 is not the right answer. So I do not know about this society or what is this, but like it has US and I know that US Gynae Society they recommend screening from the 21st year. So I think it might be the answer, but like if this is in a different society, it might change. So I will just mark it for review. All the following features are associated with complete molar pregnancy, except so complete molar pregnancy. P57 KIP2 immunostain negative. So in complete, there's P57 is negative. This is right. Focal villus edema. So no, complete में you see like grape-like cluster. They have complete villus edema. Focal edema is seen in like incomplete molar pregnancy. There's absent embryonic pole. Obviously, there's no like participation from the ovum. So only the sperm is entering and ovum is disappearing. So there will be not be embryonic pole. 15% risk of post-molar pregnancy. So I'm not sure about this figure. Like I remember studying like 20% in complete molar pregnancy and like about 4 to 5 in incomplete molar. So 15 is sounding nice, but like focal is obviously seen in incomplete. They are asking about complete molar associated complete molar pregnancy, except this is not seen in complete. This is seen in incomplete. Which of the following autoimmune disease is not commonly associated with Sjogren syndrome? So in Sjogren syndrome, which disease is not seen? Chronic active hepatitis and Sjogren, obviously, they have some link. Primary biliary cirrhosis, rheumatoid arthritis, and Graves' disease. So, like chronic active hepatitis, it is associated with Sjogren. I remember it. PBC, from primary biliary cirrhosis, can be associated with Sjogren syndrome. Rheumatoid arthritis and Sjogren, I like. In rheumatoid arthritis, you can see Sjogren syndrome, like secondary Sjogren syndrome occur in rheumatoid arthritis. There is dryness of the eye and nose and mouth. Graves' disease, like I haven't read anything like connecting Sjogren syndrome with Graves' disease. So like thyroid and Sjogren connection between them, I haven't come across. So I'm not sure about this. I know A and B are correct. I'm confused. Like C, I think this is correct. So I will just mark it for review. False regarding autoantibody in SLE. ANA is positive in more than 95% of patients. So ANA has a sensitivity of 95% in SLE. So this is correct. ANA test using IF method more reliable than ELISA. Obviously, like previously we used to do ELISA. ELISA just give you positive or negative. But like this hep to cell, when we do IF on hep to cell, there's like they give ratio 1 is to 80. 1 is to 80 or more is like diagnostic of SLE. Anti-Smith antibody correlate with disease severity. This is right. High titer Ig antibody to double strand DNA are specific for SLE. Yes. Anti-Smith and anti-double stranded DNA antibody are specific for SLE. ANA is more sensitive. So this is correct. ANA is positive in 95% of SLE. ANA test using IF method are more reliable than ELISA. This is correct. Anti-Smith, anti-Smith is the most specific antibody of SLE, but this does not correlate with disease severity. And high titer IgG double stranded DNA are specific for SLE. So take A, B, D options are correct. This is incorrect. Like with disease severity, we see like ESR and CRP values, and like anti double stranded DNA antibodies. I think they correlate with severity, but anti-Smith has nothing to do with like disease severity. So I think this is the answer. Hallmark feature of uh, analytical epidemiological study is, so they are like two epidemiological, observational or analytical. Analytical. So use of appropriate comparison group, laboratory confirmation of the diagnosis, publication in a peer-reviewed journal, statistical analysis using logistic regression. I do not know about this. I will just skip the question. Classify the study. Residents of three villages with three different type of water supply were asked to participate in a survey to identify cholera carriers. Because several cholera deaths has occurred in the recent past, virtually everyone present at the time submitted to the examination. The proportion of the residents in each village who were carriers were computed and compared. Classify the study. So like this cannot be cohort. Cohort is like exposure to disease perspective in time. So cohort, this cannot be cohort. So three villages, three different type of water supply has to participate in a survey to cholera carriers. The proportion of residents in each area who were carrier were computed and compared. Identify the study. So I think this is like cross-sectional study at like snapshot of the time. You are just getting the prevalence, how many people are cholera carriers among the like three different villages. Case control, like in the case control, you take some cases, you take some controls, and you go retrogradely and ask about exposure. So no, this is like a snapshot study. So cross-sectional is the answer. Identify the test being performed. So this is for like meniscus injury. This is Apple's grinding test. So like stress test is for the medial or lateral collateral ligament. We do not hold like this 90 degree in McMurray's. We do not hold like this flexion 90 degree. We do only 30 degree to 25 degree. Apple's grinding test. Yes, this is right. We like flex the knee to 90 degree. Then we rotate medially or laterally to see like if there is any pain. Hastily test, I do not know about this test. So this is looking right. A child was advised yearly vaccination with a vaccine which is not a part of NIS. Yearly vaccination is recommended against. So like INS में नहीं है. So yellow fever you do not do yearly vaccination. This is out. Tetanus you don't do yearly vaccination for tetanus. H influenzae. Like this is obviously definitely not in INS yearly vaccination, but I do not know about this. Influenza, I remember like there is annual change in strains of influenza due to some genetic shift and genetic drift. So there is yearly vaccination for influenza virus is advised, but for child I do not remember. But among the four options, C and D are ruled out. H influenzae vaccine I remember like we give it in 5 or 10 years. Annually, I remember only influenza virus because like their strains changes every year due to some genetic changes. So this is the right answer. Which of the following monoclonal antibody? So many questions from monoclonal antibodies is approved for the reversal of serious bleeding due to dabigatran toxicity. So this is a pharma question. So in dabigatran, I guess it was like darucizumab, something to do with daru. Pembrolizumab, obviously, this is used in cancer. Natalizumab, ulcerative colitis. I do not remember this. Like, what is this? Destuzumab. Idarucizumab, obviously, it is used. Like, I have remembered by like Daru. Which among the following diseases you close sign on barium in EMA study? Close sign intussusception. Like, this is basic radiology question. You should make just a table of what sign is seen in which condition or which like investigation. So some histopath image. We will read the history first. Which of the following virus play the important role in development of this condition? Okay. 51-year-old male has been have a problem through the nose for a few months. Sometimes epistaxis occur. General examination left cervical lymph node is enlarged. CT scan is 3 centimeter mass is noted in left nasopharynx. So old man with nasopharyngeal cancer. So, like nasopharyngeal cancer, Epstein-Barr virus is involved in this. Biopsy of the mass epithelial cell with round vesicular nuclei, prominent nuclei are seen, as shown in the image. Abundant lymphocyte is shown infiltrating the lesion, as shown in the image. Radiotherapy is advised. Which of the following virus play most important development of this condition? This is nasopharyngeal cancer. Kind of like left lymph node is also enlarged. And histopathology, they are given a vesicular nuclei and prominent nuclei. So looking like squamous cell cancer of the nasopharynx. Lymphocytes, I do not, I'm not sure about this, like what they want to say by abundant lymphocyte. But like radiotherapy is obviously treatment for nasopharyngeal cancer. Epstein-Barr virus is involved in causing the nasopharyngeal cancer. So I will go with EBV. What is the finding seen in the image? So let's read the history first. 75-year-old male presents with complaint of poor voiding, straining, hesitancy, increased frequency, sounding like BPH, benign prostatic hyperplasia. USG shows the following image, but which of the following seen in this image? So I guess this is black, this is fluid. So this is urinary tension in the bladder. This thing I think this is prostate, and like this are narrowed down the urethra. So bladder tumor, bladder diverticula, bladder calculus, and thimble bladder. So no BPH. So this cannot be bladder tumor. Like in bladder tumor, there will be history of like blood in urine. Here symptom like lower urinary tract symptom, poor voiding. So like something is obstructing the urethra. So bladder cancer cannot be the bladder diverticula. It might be the answer like diverticula. You see those lower urinary tract symptoms. Bladder calculus, you see those symptoms, but calculi, I think will be like shown like some whitish in the black background. I do not see this is homogeneous black. Thimble bladder is a feature of TB, like TB of the bladder. So thimble bladder, if they give, they will give you sterile pyuria. So this cannot be the answer. So I'm thinking about like bladder diverticula. They have given like this is the bladder, and obviously this is not prostate. This is like some diverticula coming from the bladder. So urine is getting stored in it in this diverticula. So this is also black. So diverticula is, I think, most appropriate answer for the question. Inflammasome has been implicated in which of the following disease? So this is like general path question. Inflammasome, I remember reading like this is enrolled in NOD, clearing of necrotic debris, some iron transport, and some diseases. So diseases include some CNS degenerative disease, diabetes, and gout. So gout, diabetes, Alzheimer's. So all of the above will be the answer. So like this is like direct text line from the Robbins in general path chapter. So this like general path is very important from like Robbins. They give Robbins pictures and all the stuff. Few years back, they asked about those like first chapter from the Robbins, some seven type of those red wine and like diabetes improve with it. Which of the following diseases is transmitted globally by all the mosquitoes? Transmitted globally by all mosquitoes. Uh, there is a table of mosquitoes. I remember Anopheles culex filaria and Mansonia mosquito. In all of the mosquitoes, they write filaria outside of the India, except the culex. So malaria is called only by malaria, like Anopheles mosquito. But like Anopheles causes filaria outside India. Culex causes like outside India. So I think they want to ask the same thing. The thing I am thinking about, like in that table, filaria was all of the like four of the mosquito, and filaria was every one of them. So filaria, I think this is the right answer. Obviously, they have written globally, so like outside India. So this is matching. Not supply to the marked structure in the given image. So like this is a very cliche question of like INI or NEET. So like they just want you to know if you identify the muscles correct. So like this diagram should be at your fingertips. So obviously this muscle is LPS. This is superior rectus. This is medial rectus. This is lateral rectus. So medial and lateral rectus, there is no confusion. This is superior rectus and this is LPS, not superior oblique. Superior oblique, remember, it just comes from the medial side. It finds a pulley in the orbit and just insert into the eyeball. So this thing is like superior oblique outside of the circle. So SO4 trochlear nerve. So this image is very important. You must remember all the muscles, and especially they confuse you with these two muscles, LPS and superior oblique. But obviously, this is inferior rectus. Like close to globe, this is a circle, all the rectus muscle, and this is inferior oblique, which comes from the like floor of the orbit, and then it just winds below the inferior rectus and just inserts on this side. So this is a very good question actually. So we have 8 minutes remaining, and we will just review the questions we have left. So safe method for disposal of mercury. Like there is mercury disposal in hospital, so they ask this question. We have ruled out like B and D. So we collect it carefully. but I do not think like recycling the mercury is like it is safe, but this is not in general practice. You just I think you just treat it with chemicals and you just dispose it like in the drainage. So I think this is the right answer. So organophosphate poisoning, so this cannot be the answer. Less than 50 is the like criteria defining the OP poisoning. So when we will divide this thing mild, moderate, severe, so they are given like 20 to 50, 10 to 20, less than 10. So I think this will be the severe, this will be the moderate, and like less than 50, this option look like mild. They have asked mild. So this is just a wild guess. Just by the fact I know कि less than 50% is called OP poisoning by the laboratory criteria. So I will just go with this option. Like this is looking right to me actually. So they this is according to USP-STF. So I do not know this society. I just remember like there is jo Federation of Gynecologists in US. They recommend screening from the age of 21. So it has something like US. So I think they in the US they have the same screening. So like sometimes happen different society they have given like different ages for like screening of different diseases. So I'm just confused. Like 35 and 30 cannot be the answer. I back of the mind I think like this different society like it is something different. I haven't studied, but I will go with 21. Like in the US they recommend by the 21 they you start your cervical cancer screening. So 21 is looking nice. So they have asked about the disease not associated with Sjogren's syndrome. So Sjogren's syndrome is like glandular and extraglandular. There is the dryness of nose, eyes, and mouth. So hepatitis and primary biliary cirrhosis are definitely associated with Sjogren's syndrome. Rheumatoid arthritis, I think, like in secondary Sjogren's syndrome, rheumatoid arthritis is the most common cause of secondary Sjogren. You see like dry eyes in secondary rheumatoid arthritis. Graves' disease and Sjogren's syndrome, I haven't studied like any of thing like this the connecting some connection between Graves and Sjogren's. I haven't studied, so I think like Graves may be the answer. Also, like I haven't seen any of the question like mentioning some patient having like Sjogren's and Graves together. Although they can happen, like autoimmune diseases obviously like come in package. So I'm just like somewhat sure about three options. I'm just unsure about Graves. I'm gonna mark Graves. Like I'm gonna go with my gut feeling. So we have left one question. The hallmark feature of a analytical epidemiological study is. So like I remember there are two type of observation and analytical. Observation is like going from bottom to up. Analytical is like going from up to down. You make your you have your like the final your theory and you just apply to some groups and see is it true or not. So this is the like basic idea I have of these studies. So these options are very confusing to me. Like I do not know about anything like this analytical study and publication confirmation. So I think I'm just gonna skip this question. So we have skipped only one question in this. Uh, we have done 39 questions, and we still have like 3.5 minutes remaining. So in the meantime, you should just go through some questions really in fast speed. So root of mesenteric crosses which of the following structure? So like it goes from left to right. So obviously IBC and aorta will be crossed. So this is the correct. Like I'm sure about this option. These three options like kind of I have ruled out, but I'm just don't remember written in these my notes. I do not have any visual memory of these things, but I know for sure IBC is definitely crossed by the root of mesentery because it crosses the midline. So I just mark this option. So this is like green discharge ductal. There is a risk of breast carcinoma in benign condition like atypical. When your atypical comes in pathology, there is always a risk of cancer. Facultative anaerobe, E. coli is obviously facultative anaerobe. All enterobacteriaceae is facultative anaerobe. So I was confusing this question. Primary in nature curvature. So like cervical is concave, lumbar is concave, but like thoracic and sacral are convex, and these are like matches or embryological spine. So thoracic and sacral will be primary according to me. Oval fat body, a young like minimal change disease type history, nephrotic syndrome. Silent appendicitis. So we know like heterocecal pelvic they causes so much of trouble. Subcecal obviously this is like second or third most common. Post-ileal is like a rare type of appendix position. We all know like it is found only in 1 or 2% of the people, and like when in these people appendicitis occurs, much like this is very like silent type of picture. There is only some pain in the abdomen, some ill-defined pain. So I think this is right. Most useful in digitalis toxicity, Dizzybind. So, like cardioversion, hemodialysis, atropine, and Dizzybind. The most useful method actually, like I'm not sure. Dizzybind is a very specific drug for digitalis cardiotoxicity. We do like we do not do hemodialysis and digoxin toxicity. This is I'm sure because like it gets distributed to like your muscle tissue, so won't be of benefit. Cardioversion we can do, like obviously digitalis causes arrhythmia. So arrhythmia we do cardioversion, but like they are the most useful method. So like in Casino Royale of James Bond movies, obviously like some girl put digitalis in his drink. So obviously in the like they asked James Bond to inject himself with lignocaine. Like I'm not sure about most useful what they want to ask, but this event is more specific, so I'm just gonna go with it. Most common site involved in tinea cruris. So this is the word they want you to expect. Like cruris is for the inguinal region. So this is a very simple, like just basic knowledge. So in 9 seconds, we have upcoming section E and the final section. So you must be careful in doing the last section. Which among the following arteries give a branch to the inferior thyroid artery? Which of the following arteries give a branch to the inferior thyroid artery? So this is some like ill-framed question. Like inferior thyroid artery is a branch of. So like it is thyrocervical trunk, obviously in the name. External aorta to give rise to superior thyroid artery. ICA doesn't give any branch in the neck. Aorta obviously have only three major branches. So you can obviously like recheck your answer by comparing to like ruling out other three options also. Fothergill operation does not include. So like Fothergill operation is for like prolapse. So in this condition, we kind of like amputate the cervix. Cervical amputation is definitely there. Anterior colporrhaphy, posterior colpoperineorrhaphy, and vaginal hysterectomy. So like Fothergill operation is done when the female wants to keep her uterus. So obviously hysterectomy won't be as a Fothergill operation. So like you do some sling surgeries of Fothergill operation just to preserve the uterus of the female. So obviously you will not remove the you will not do the hysterectomy in this operation. So if you just know like the basic purpose of the surgery, like in what condition and what the need of the female we do the surgery, so you can attempt the question without knowing like what steps you do in the surgery. The most likely diagnosis is child is below third percentile of the height, so short stature case. So this is kind of the question came in May INI. His growth velocity is normal, but chronological age is more than his skeletal age. So like they want to say their skeletal age is less than chronological age. So most likely diagnosis is his velocity is normal. So kind of this is constitutional delay when the velocity is normal, but child is below the percentile, and this is like the line which gives you the answer ki his born age is less than a chronological age. So like in constitutional delay in the growth, it is just like the child lags behind 2 to 3 years in his growth. So like he is 2 to 3 years behind the chronological age. But in the end, growth velocity is normal and he will gain the normal height, but just 3 years after he is supposed to. So this is like a very important topic for INI. There was treatment of choice. 25-year-old female came with left flank pain, vaginal discharge for 2 months. Vaginal discharge for 2 months. She has a history of fever. Bimanual examination, there is a fullness and palpable mass in left fornix. She is diagnosed with tubo-ovarian abscess. What is the treatment of the choice? So she has like pain and discharge, and there is the like mass on the left fornix. She is diagnosed with. So, like treatment of choice in the tubo-ovarian abscess, we kind of admit the patient and we give them antibiotics, IV antibiotics. And when the patient improves, that's fine. And like if the size does not reduce or the patient continues to be symptomatic, we do like micro-invasive surgery, minimally invasive surgery, and remove the like drain that abscess. So treatment of choice, they are asking for like some tubo-ovarian abscess. So wait and watch cannot be the answer. And we do this as a first step, but like they have asked treatment of the choice. So treatment of the choice remains the MIS, minimally invasive laparoscopic surgery. So like this word changes the whole answer if they are asking the first step in the treatment or treatment of the choice. So I think laparoscopic drainage is the treatment of choice in tubo-ovarian abscesses. So X-ray is suggestive of. So like I'm not very good at reading X-rays, etc. But we can kind match the X-ray with the options they have given. So like ankylosing spondylitis, they will give you a X-ray of like sacroiliac joint, like AP view. So in this X-ray, I don't think they kind of expect us to know like how AS looks in this X-ray. So AS cannot be the answer. Reactive arthritis, reactive arthritis like affects your knees, your hip. So this is like spine X-ray. So this doesn't look right. Renal osteodystrophy. So renal osteodystrophy, there is like sandwich vertebra appearance. So yes, I'm seeing like this is like whitish. This is black, whitish, black, white, black. So this is like stripes of like football jersey. So it might be the answer or spine. Obviously, they give for this appearance they give the spine X-ray. Dish obviously for dish they give this view only, but like in like this is diffuse idiopathic skeletal hyperostosis. So I think they will be like more whitish. The vertebrae will be more whitish. There won't be like any like black lucences in them. So I think they want to ask renal osteodystrophy. Like in these type of radiography questions, you just apply to your common sense. This X-ray, can they ask this X-ray in this disease? So like I have ruled out like reactive arthritis, they cannot give like this lateral spine X-ray. And also in ankylosing spondylitis, they will give like SI joint AP X-ray, not this view. So AB I have ruled out like easily by like just applying common sense. Renal osteodystrophy and dish are obviously we have to choose, and dish we know this X-ray appearance is seen in renal osteodystrophy. How many sputum samples are needed for the diagnosis of TB? So like TB you must know through and through. So we collect obviously like you must have done in your internship. There are two samples collected. There is a one sport sample and there is a early morning sample. The sport sample is just like after you see the doctor, and sputum sample you come early in the morning, empty stomach. So there are two sputum samples are needed for TB. What is the next step for the treatment? G5, P4, abortion 0 and life 4. Patient was diagnosed with gestational diabetes mellitus and is on medical nutritional therapy. After 2 weeks of medical nutritional therapy, FBS was 100 and PBBS was 140. What is the next step of the treatment? So like she is already on MNT, and like with the only nutritional therapy, there is PBBSs of 140. So like there is a criteria. If she remains above 140, we start her own drugs. If she is below 120, so we continue the MNT. So they have given like 140 PBBS. So 140 and above, we obviously want to start her with own drugs. So we will switch over to our insulin injection. Drug of choice for like gestational diabetes is insulin only. So we cannot continue MNT. MNT is continued when this figure will be below 120. So we prefer insulin over oral hypoglycemic drugs. So I think insulin injection will be the appropriate next step. Most commonly affected vessel in Takayasu. It's subclavian obviously. Like Takayasu is called pulseless disease. So you will be pulseless when there is obstruction in the subclavian artery. So there is a like order given in Takayasu arteritis. You might not need to remember the order. Like starting 2 or 3 arteries you need to remember. Which part of the GI tract cancer occurs due to Crohn's disease? So colon cancer, obviously, we know Crohn's and ulcerative colitis are risk factor for colon cancer. HSG finding in tuberculosis salpingitis. So this question came in like this NEET PG 2024. They gave a picture of USG and history, and they wanted to ask about tuberculosis salpingitis. So TB is obviously important in every chapter. HSG finding in tuberculosis salpingitis are all except. So tobacco pouch appearance, obviously we see. Powder bun appearance is seen in endometriosis, not like in TB. Lead pipe is obviously ureter or fallopian tube. Both are seen in TB. Gold stick appearance obviously at the end of like fallopian tube you see gold stick. So powder bun, I'm sure this is seen in endometriosis. But obviously, this is not seen in HSG. This is seen in when you like put laparoscope in the abdomen of the female. The patient has most likely developed. So, okay, like a question. 77-year-old male is referred to you for the treatment of critical gout. Serum uric acid is 12.5. This is increased actually. And he has mild renal insufficiency with the serum create value of 1.6. This is also mildly elevated. Allopurinol and once daily colchicine are prescribed. He presented 1 week later with the new onset of fatigue and ecchymosis. This mostly has the patient has most likely developed. So, so the patient has gout. He has been prescribed colchicine and allopurinol. Like colchicine side effect, we know apart from nausea and vomiting, bone marrow failure is like one side effect of colchicine. Or like they have given like he has fatigue, so anemia, ecchymosis, low platelets. Like bone marrow failure has occurred in the patient, and they've also given history of colchicine. So I think the patient has developed aplastic anemia due to colchicine. Colchicine cannot cause AML. ITP is not. MDS obviously not. All the following are effects of increased intra-abdominal pressure except. So like this is the thing we read in intra-abdominal hypertension. Also in when we read about the effects of laparoscopic insufflation, what happens in the body. So obviously reduction in the visceral perfusion, there is an increased pressure inside your abdominal cavity. Decreased ventilation pressure. This is wrong. Like when the like air is insufflated or like intra-abdominal pressure increases, so it pushes the diaphragm upwards. So you have to like increase your airway pressure to breathe in. So that's why we avoid like laparoscopic surgery in COPD patients. Rise in ICP, obviously they will be like rise in ICP or decreased cardiac output. So when there is increased pressure in the abdomen, they will be reduced like preload to the heart. So obviously cardiac output will be decreased. So like this is like cliche. You obviously, if you don't know the concept of this thing, you can do still attempt the question by knowing like in the laparoscopy you avoid a laparoscopic surgery in COPD patient because you have to increase the ventilation pressure for that patient. So there will be increased pressure, not decreased. Which of the following is not true with respect to disaster management? Mitigation before a disaster strikes. Right, like it comes in like preparedness and mitigation phase. Response in pre-disaster phase. No, response occurs post-disaster. When a disaster struck, so then the response from the like authorities come. Yellow color is for medium priority. Yes. Black is for dead. Red is for higher priority. Green is for ambulatory patient. Yellow is for the medium priority. Gastroenteritis is commonest infection after disaster. Yes, that's why chlorination of the water after any disaster is like most important step to tackle the disaster. So obviously response, this is a common sense question. Like actually you cannot like do response phase in pre-disaster phase. In pre-disaster you can only do like preparedness and mitigation. All of the following are systemic effects of inflammation except increased sweating, increased pulse and blood pressure, leukocytosis, LCRP. So inflammation means CRP increases, WBC increases, increased sweating. Like they will be fever, they will be like sweating in the like phase of fever. There is increased pulse. Yes, pulse increased like inflammation and blood pressure. So this doesn't seem right. Like there will be increased temperature of the body, so sweating will be increased. WBC CRP will also increase. Which of the following medications would most likely be effective in treating the man's headache disorder? So, 35-year-old man reports brief but severe attack of stabbing pain over his left eye lasting for 2 to 3 minutes. So the time of the headache is very important. It is lasting for 2 to 3 minutes. So like migraine occur from 30 minutes to 4 hours. So it cannot be migraine. So you have ruled out the migraine. And obviously a man with severe attack of stabbing pain over his left eye occurring on a daily basis for past 3 weeks. The pain attack is followed by complete resolution, although another attack may occur immediately afterward. In general, headache occur from 10 to 20 times per day without a clear diurnal pattern. Just prior to pain, he notices his left eye becomes red, although he does not notice any tearing. Left eyelid does, however, appear some swollen during attack. MRI of the brain is normal. Following medication will most likely effect on treating the man's headache disorder. So like this is a question from like that SUN CTU cluster headache wale headache table. So is 2 to 3 minutes. So they are like cluster headache. There is hemicrania continua, and also there is like one condition called SUN CT that cannot happen. Hemicrania continua. He has attacks, not continuous pain. So I am thinking like cluster headache for this patient. So like he has pain attacks 10 to 20 times per day, or some like red eye tearing symptoms. So for the cluster headache, like the acute treatment, we give high flow oxygen or like sumatriptans. But like chronically for managing the patient, it's indomethacin is incorrect, prednisone is incorrect, lamotrigine and lithium. Uh, so I do not clearly remember the drugs for headache disorder. So lithium, I don't think like lithium we don't use in headache disorders. So lamotrigine feels right. Indomethacin is for like hemicrania continua or like that disorder. Lithium psychiatry drug. Steroid we do not use in like for headache actually. So like lamotrigine, I think this is the right answer for chronically managing the this headache attacks. What is the most likely antibiotic? 66-year lady, swelling and pain on left tail after 2 week duration of antibiotic therapy for upper respiratory. MRI of the ankle is given below. So like MRI, we can see there is a rupture of like this Achilles tendon. So tendon rupture is obviously FQ. FQ side, fluoroquinolone side effects is a tendon rupture. So we have to just select the fluoroquinolone among them. So these all are penicillins. This is penicillin. This is levofloxacin is a fluoroquinolone. Side effects, well-known side effect of tendon ruptures. Which among the following is most likely cause? 32-year-old primary gravida, obstructed labor with CPD. Cesarean section was performed. Now the patient passes of urine from the vagina. So going toward a direction of like fistula, some fistula formation between the urinary tract and vagina. There is a methylene blue dye test. Middle swab is wet and stained with methylene blue. So like there are three conditions. The fistula can be connected to ureter, can be connected with bladder, can be connected with urethra. So like if the middle swab is getting wet and stained with blue dye, so it is obviously the psychovaginal fistula, which is connection between vagina and urinary bladder with psychovaginal fistula. Rectovaginal, you won't see like urine coming out of vagina. Uretrovaginal, you see only lower swab getting wet. Uretrovaginal, there will be no like bluing of the, there will be no dying of the swabs. So this is like VVF, VVF, typical three stick methylene blue dye test. Non-valent HPV vaccine against which of the following? This is a previous year question, and especially INI CET is very fond of asking the questions which include some numbers. So you have to just cram those nine numbers. This is like 6, 11, 16, 18, 31, 33, 45, 50 to 58. This is looking right. So you might want to check. They haven't given 6 or 11, so this is wrong. 6, 11, 16, 18, 31, 30. 39 is not there. After 33, there is 45. 6, 11, 16, 18, 31, 33, 45, 56 is not there. This 52. So like this is repeated question, previous year question. All of the following statement regarding Kawasaki disease are true, except it can mimic infection. Obviously, Kawasaki is like DD. Obviously, there is infection coming. Exposure to an affected person can increase the risk. I do not know about this thing. 80% of the patients are younger than 5 years. Yes, like Kawasaki is a disease of child. I do not know about this figure. So obviously they want to say like most of the patients are like less than 5 years. So this is correct. This is correct. And do not know about this thing. It is the leading cause of acquired heart disease in children. Like it causes coronary artery aneurysm, but I'm not sure like it is the leading cause or like rare cause. So we have to choose the like false option. A and C are correct. This one I am sure. So exposure to an affected person can increase the risk. So like Kawasaki is a kind of vasculitis disease get triggered by some viral infection. Like after COVID, also Kawasaki cases were seen. So like exposure to an affected person can increase the risk. I'm not sure because like it actually happens to some like predisposed individuals. It is a leading cause of acquired heart disease in children. So like Kawasaki is very common in like Indian subcontinent and South Asian countries. And Kawasaki says the name, obviously like some Japanese doctor. And it causes coronary artery aneurysm. So it is the leading cause of acquired heart disease in children. So it might be true, but like exposure to an affected person can increase the risk. This is not sounding right because like it is not an infection. It is like some persons are predisposed to get like this vasculitis. So this is like sounding wrong. Which of the following act is reservoir of HIV? So like HIV, follicular dendritic cell, T follicular helper cell in germinal center, both of the above, none of the above. So like obviously they stay in CD4 cells. They also stay in follicular dendritic cell. So like both cells, they act as reservoir. So I will go with both of them. Which of these census reports is used as a source of data? I like I haven't read like this classification of data, primary, secondary, but like which of these census reports is used as a source of data? I will skip the question. Like when you come across a question like this, which you do not have any idea, and after reading it doesn't ring a bell in your mind, so just skip it instead of getting -1. Drug-induced ILD is caused all except. So like this is like NSIP mnemonic, I remember, nitrofurantoin. Obviously, methotrexate obviously cause lung fibrosis. Amiodarone, high side effect lung fibrosis. Nintedanib is actually used to reverse the pulmonary fibrosis. Like in idiopathic pulmonary fibrosis treatment, nintedanib is one of like treatment for IPF. So obviously, methotrexate, amiodarone are both important drugs. You will separately read side effects, lung fibrosis in both of them. Nitrofurantoin, you read like NSIP, drugs causing lung fibrosis. Nitrofurantoin, like sulfa drugs, IP. P, I don't remember what was it. So nintedanib, you obviously know ki it is used in treating the fibrosis, not causing fibrosis. Which of the following is not a diagnostic criteria for gestational trophoblastic neoplasia? So beta SCG for four measurements during a period of 3 weeks or longer. Rise of SCG 10% during 3 week consecutive management or longer. Okay. Beta SCG remain undetectable for 6 months. Histological criteria for. So obviously, like they're asking about trophoblastic neoplasia, like some neoplasia after molar pregnancy. So like if they are plus minus 10% of four measurement of SCG, that's true. If 10 more than 10% SCG value occurs, so this is like indicative of GTN. Obviously, histology, you cannot beat the like histology for any of the cancer. So histology is obviously criteria. So beta HCG level if remains undetectable for 6 months, so it is not neoplasia. Obviously, this is not neoplasia. In neoplasia, it will remain like plateau. This is the same or will increase. So like this is the like good feature of molar pregnancy. HCG become undetectable. You are free of GTN. Which of the following is the next best step of the management? So 5-year-old child, coagulation disorder presents to emergency with a growing pain after a minor trauma to his back. His blood pressure is 60 by 30. Pulse rate is 180. He holds his right hip in flexion position with internal rotation. Which of the following is the next best step in the management? So like kind of looking like hemophilia. So like after minor trauma, there is some like hemarthrosis or some muscle hematoma. So he's having some pain. Blood pressure, I do not know, like for a 5-year-old child, 60 by 30 is normal or decreased, but kind of looking like some low BP. Pulse rate is definitely high for 5-year-old child. There is a hip inflection and internal rotation. So there may be hemarthrosis. So what will you do the next best step for the management? So USG abdomen factor 8 assay. So like this is like most likely hemophilia A. So in the emergency, you will like first of all, you want to confirm the diagnosis. It might be hemophilia B, and obviously DDAVP used in hemophilia A. You can use it. USG abdomen there is like less role, I think. I will mark factor 8 assay first to diagnose uh, before like you do replacement for factor 8, which is like a very costly drug. I will review it later. I'm not sure about this. Match the following tumor suppressor gene or disease caused by the mutation. So these type of question I was like warning you about. Like you do not have a pen or paper in your NEET examination, so you cannot write. So you just like have to be extra careful while like matching these things. So APC is obviously for colon cancer. So 1B. So this is wrong. This is wrong. This is right. This is the only. So rest you should check also. Sometimes like they confuse you. Like especially in INI CET they give two or more to correct. So you have to match according to them. So one is B, two is A. PHL is pheochromocytoma obviously. P10 T. So P10 you get like breast, uterine, and thyroid. So endometrial is okay. 4C E cadherin for gastric cancer. So this is correct. Which among the following is the characteristic feature of asplenia? So Heinz body, how usually would you see in asplenia? Heinz body you see in like that G6PD. Pappenheimer is a feature of like that anemia, anemia of sideroblastic anemia. Codocytes, what are codocytes? I don't know codocytes, but Halsoli body are obviously features of asplenia. Obviously, like if you study these changes after splenectomy surgery also. Clean care is safer care guideline given by WHO is like obviously WHO emphasis on hand hygiene is unmatchable. So clean care is safer care. I guess it is for hand hygiene. Ops care, cold care, injection practice. I don't think. So I'm strongly thinking about like hand hygiene. So WHO like pressurizes like coffee promotes hand hygiene. So clean care is safer care. I think it's hand hygiene. Which of the following diseases have the peripheral smear finding? So like this is like cliche picture, A beta lipoproteinemia. So they give this like acanthocytes, Like acanthocytes are asymmetric, so you can see like asymmetric spikes. This. Obviously, you can rule out the options. Alzheimer's has nothing to do with like RBC or hemat. Parkinson's has nothing to do with hemat. Multiple sclerosis has nothing to do with like peripheral smear or hemat. A beta lipoproteinemia, obviously, you see like there is some lipid defect. There is like low fat, vitamin E deficiency, malabsorption, plus these acanthocytes. So like these kind of question, like if you see the question and if you not like you do not remember this peripheral smear, just read the options first. And sometimes they give so like foolish options, you can rule three options easily out, and the rest is the answer, even if you don't know that, like even you haven't heard of that, like that disease. 25-year-old lady, known case of PCOD is distress due to hirsutism. Which of the following is the best treatment? So PCOD, we say like weight loss is the best treatment, and drug of choice is OCP. So like OCP, ethylene estrogen plus levonorgestrel, this is like basic OCPs. Ethylene estradiol plus dinoprostone. Levonorgestrel alone cannot be given none of the above. Like ethylene estradiol LNG is the like basic OCP we prescribe in PCOD, but like they have specially mentioned hirsutism, like ethylene estradiol, and this dinoprostone is I think they have anti-androgen property, and hirsutism is obviously due to like increased androgen in the body. So I'm thinking like marking this because like dinoprostone is a better progesterone than levonorgestrel for its anti-androgen property. So I think this is the answer. Stamping gate is seen in. So stamping gate in foot drop you see like high stepping gate. Stamping gate is I think when there is some problem in like spinal cord vibration and proprioception problem. So like patient tend to like stamp the ground just to get the idea of proprioception vibrations. Um, Hemiplegia is ruled out. Foot drop is ruled out. Myopathy is like okay. Sensory ataxia. This is looking like nice. Like when the patient does not have the sense of proprioception due to like maybe vitamin beta B12 deficiency or posterior column defect. The patient develops sensory ataxia. He tried to like stomp the ground to get just the feel of like proprioception or vibration. So I think ataxia is right. Myopathy. Is like sensory detection is looking more accurate than myopathy. Myopathy might be like anything to do with the spinal cord. All of the following are risk factor for the ectopic pregnancy except previous history of ectopic. Obviously, gynae, every condition previous history is the risk factor for the like future episodes. Salpingectomy, if you play with fallopian tube, obviously there is a risk of ectopic pregnancy. Infection, obviously, if the tube is damaged, obviously there is a chance of implanting the embryo in the fallopian tube itself. Smoking. So I do not know about like smoking is the risk factor or not, but like they're asking risk factor for ectopic pregnancy, except so like previous history is a risk factor, salpingectomy is the risk factor, pelvic infection obviously most common risk factor for ectopic. Smoking, take care. Like I have ruled out three options. I do not know about this thing, so I can mark it. For determining the maturity of a newborn at birth, which of the following scoring is used? So like this like from just if you know just the like overview of the topic, you will can do this question. Ballard scoring, like in PEDS internship, we do this scoring in a final prof exam. So this is very simple question. Ponderal index is for like symmetric or asymmetric like growth retardation. Bhutani score, I don't know what is this. Malampati is for anesthesia, airway. So Ballard score. So point mutation in which of the proton cause in a possibility? So kind of path question. 40-year-old women presented to OPD with a 2 centimeter thyroid nodule. Euthyroid, family history thyroid cancer is positive. FNAC medullary thyroid carcinoma was given, and hence total thyroidectomy was performed. Point mutation in which of the following oncogenic possibility? So in medullary thyroid cancer, RET gene, like you have to remember just one gene RET, because medullary thyroid cancer is also seen in man too, and man too is related with RET mutation. KRAS associated pancreatic cancer, HGF, something to do with liver, like hepatocyte growth factor. It is CKIT, like it is like a testicular or that kind of cancer. RET is involved with like medullary thyroid cancer. Which of the following statement is false regarding the epidemiology of amoebic liver abscess? So these kind of questions are asked in INI actually. So commonly seen in 20 to 40-year of age group. Amoebic liver abscess, okay, like we see in this age group, like more like less age group than the like its counterpart bacterial liver abscess. Females are predominantly infected than males. This is wrong. Like amoebic liver abscess is more seen in like alcoholic males. I have seen so many patients in my internship. I don't think females are predominantly infected with males. Menstruating females have a low incidence rate. I do not know about this thing. More commonly associated with immunocompromised. Okay, might be. Like I had seen more in alcoholic patients actually. I do not know like if immunocompromised state has nothing to is something to do with it. But like they have false about the epidemiology, and I know for sure amoebic liver abscess is seen more in male patients. Like I haven't seen any female patient in my internship. Amoebic liver abscess. So yeah, this is sounding nice. CND I do not know anything about. A is kind of right. So I think I will gonna mark this answer because males are more infected. So this is false, and they are asking false. So sometimes we just have to believe our instinct, what you have read, what you have seen. Uterine artery Doppler in pregnancy is used in. So uterine artery Doppler you do when there is growth retardation of the baby to predict the preeclampsia, to assess the FGR, fetal growth retardation. So like fetal growth retardation, we do like AFP and that score, Manning score. Uterine artery Doppler to assess the SGA baby. So these are kind of same things. To predict the preeclampsia, there is some event of like notching of the uterine artery Doppler. So if it persists beyond like 22 or 24 weeks, we can predict like this lady is going to develop eclampsia. So I think uterine artery Doppler I have read in like preeclampsia. After 22 weeks, we see if notch disappears or not. So this is the next question. Which among the following statement is false for ulcerative type of intestinal tuberculosis? Develops secondary to pulmonary tuberculosis. Every other tuberculosis develops secondary to pulmonary tuberculosis. Develops multiple longitudinal ulcer. So in TB we get transverse ulcer. So you can remember this is the intestine, and obviously TB causes structure and intestinal obstruction. So in longitudinal ulcer it cannot cause like structure because longitudinal will be like along the length of the intestine. Meanwhile, the otherwise like the transverse ulcer, when it will heal, it will like form a scar circumferentially, so it can cause structure in the intestine. So like to remember the difference between typhoid and TB ulcer, you can just apply this logic. So this is incorrect. Diarrhea and weight loss, ठीक है weight loss के साथ TB can present managed conservatively by ATT. Yeah, this is right. What is the chronology of steps involved in the planning cycle? Uh, so, like planning cycle starts with analysis of the existing health situation. Then you assess the resources you have in your hands. Then you make some plan and implement it. Then you monitor after implementing it. So A should be in the end. So we have like three options in this. D should be in the first. D, C, B, A. So let's see once more. So like analysis, monitoring and evaluation obviously will go in the end. So A is ruled out. So I'm not sure like assessment of resources come first or analysis. Obviously, first in the cycle we do the analysis of the situation, then we see the resources, then we make the plan. So obviously, C is ruled out. So DCBA is looking more correct to me. Vibration testing is done with the tuning fork of frequency. So we have like tuning for like four tuning fork. So 256, 512 and 1024 hertz are used by the ENT people. So hearing test is 128 hertz is used by neurology people to check the sense of vibration. We put it on like bony prominences. Like 256 and 512 is used by ENT people. They are asking for vibration testing. So we use 128. Human ovaries contains how many follicles at birth? So, I remember it is like 5 to 6 million, like in the when in the embryo, and it start reducing until at birth. Female has only left, I guess, 1 to 2 million. Like it's 5 to 6 million, like maximum, and then it start degenerating, and at the birth it get reduced to like around 2 million. So I do not remember the figures accurately, but I think this is the answer. Which of the following biochemical abnormality is most likely associated with this presentation? 4-year-old child, a history of poor night vision, so vitamin A deficiency, dryness of the eye, frequent upper respiratory tract infection. So vitamin A deficiency is given. Physical examination, follicular hyperkeratosis, again vitamin A deficiency. Which of the following biochemical abnormality is most likely associated? So less vitamin A, reduced retinal binding protein, not sure. Increased serum retinol, this is wrong. Increased retinal, obviously, this is vitamin A deficiency, not toxicity. And this is, they are saying reduced serum vitamin E. So vitamin A deficiency, these features are not seen. Actually, like hemolytic anemia and those kind of features are seen with vitamin E. So increase, these are ruled out. This is ruled out. So decreased retinol binding protein. So maybe in vitamin A deficiency, this protein is also decreased, but this is only the option which is looking correct. So we have done all the 40 questions. So we will just review the questions. Which of these census reports is used as a source of data? So what I can understand from data, like primary data is, I think, which is collected from the their subjects. Secondary data might be kind of after analyzing the primary data, which data organized and organized and raw data is kind of which of these census reports is used as a source of data? Like in census, obviously, I think it's primary data because they collect it from the population direct itself. But I'm not sure. This is just a wild guessing, and I do not want my negative marks, so I will just skip it. There is one question remaining to review. So there was a child with coagulation disorder with some hemarthrosis. Kind of his vitals are not looking good to me. Which of the next best step for the management of this child? So USG abdomen will not do any good. We know this is hemarthrosis. We can in the emergency, will we? I'm just thinking, will we just start with factor VIII replacement? Like considering hemophilia A is the most common, hemophilia B is rarer than hemophilia A, obviously. So, and factor VIII assay might be the next best step. In the MCQ, you just want to confirm the diagnosis first, then you will give like the drugs to treat the boy. So I think factor VIII assay is the right answer because you want to diagnose first, then treat. So next best step, I think this is it. So we have skipped like four questions in section B, two I guess in section D, and one in this. So I guess I attempted 193 total questions. So in every GT or every like real life exam, I tried to attempt between 190 to 195. Like this is a good figure to get a like very good rank if you are kind of hoping to get in top 100. So Let's see the result. We have got 166 correct, 120, 23 incorrect, and 11 skipped. Oh, we did 189 questions only. Okay. So this is it.
Thanks a lot, Dr. Ravi, for spending time with all the future aspirants
Yeah.
and giving them guidance on how to approach the question paper. Your efforts of solving the entire grand test and that too live will surely help a lot of students. And we have added one more feature at Doc Tutorials. Now, all the questions in our grand test in review section, if you attempt your grand test from your application, mobile phone application, we'll also have a video recording of our faculties
Right.
explaining the question in detail. And that new feature, I'm sure, is also going to help a lot of students.
Right.
But the entire effort which you have taken to solve the GT and explain students how to find the right answer, how to eliminate the wrong answers. I think it'll help, it'll help a lot of future aspirants who are aspiring to write their NEET PG or INI CET examination in the upcoming days. And once again, we congratulate all of you on behalf of Dr. Tutorials family for securing, such great rank in INI CET examination. And we wish you a very all the best for all your future endeavors.
Yeah.
Thanks a lot.
Thank you so much. Thank you for giving me the opportunity. Like this was really a nice experience. I was kind of like out of practice for the GT, but really like when I was solving the questions, like it gave me that adrenaline rush, just like the real life experience. And obviously, I
Correct.
hope I was able to give some tips. Like some questions I didn't know, some question I didn't have any idea. But how can you like do the question even if you don't have any idea about the disease of the options? So I think this will be helpful for so many PG aspirants.
Yes, yes, I'm sure all the time you have spent will be precious for the students, and I'm sure they'll take back a lot from this grand test attempt. Thank you. Thanks a lot. Thank you.
Thank you so much.
Thank you.